Let the record reflect that this is the joint commissioners and council meeting, Stark County, Monday, November 16th. Both are represented in quorum. We'll just really quickly get some housekeeping out of the way. I have before me minutes from Monday, October 19th. Is there a motion?
I'll motion, please.
We have a motion. We have a motion and a second. Did you get those? I'm gonna have Fred be the last one to get it so we don't lose them and not collect them. And then there's just some signatures that are needed here from September. And there's tabs here to sign. Maybe. We'll let you be the responsible party for Rachel.
You need the response. I said, I'll do that.
And then we're just teeing up right now, but we'll just give everybody a chance for those documents. But we have first on the agenda discussion. Wait a minute. I have the wrong one here. Yeah. Discussion with Gosler Investment and McCready and Keene about the sheriff's pension plan. For those of you online, we'd like to try to keep this more Cliff Note level. I've got some printouts here for reference for us as we have some questions on how the plan's working. No problem. Okay. So just to let you know that, and then just 1 second, we have Mr. Walsmith here who's late for another meeting. So we'll go ahead and act on his business first.
Mr. Walsmith here, just in regards to the plat that the commissioners have, that was actually acted on last year.
September, I think.
Yeah, and for some reason, the signed plat disappeared. I don't know what happened, but it's needed to be recorded for a real estate transaction, and the parties to the litigation that was involved in it have all approved it for form. And Mr. Walsmith is here to confirm that it is in fact the correct one because he presented it last time.
Oh, that was our online meeting.
Oh, yeah, basically the plat was presented, it was read, it was approved. And I have no idea what happened to it after that. But we don't have a signed copy anywhere. The auditor's office doesn't have one. I don't have one. I brought 4 printed copies to the meeting and I have none of them. So we just need it re-signed so it can be recorded. Some of you might remember it was a subject of litigation that went on for about 4 or 5 years over Buckner's Point. And so in order to finally resolve this, we've got to get that approved plat signed so that it can properly be recorded.
So it already went through you before, but you have any questions about that? No. Just make, if you would, please just sign it and give it to Rachel so we can be sure we get this in time for that transaction to go. And that's about it, I guess.
That's all I have. Thank you. Thank you very much.
Thanks for letting them know.
No problem. Thank you, Mr. Walsmith. Don't tell me you don't even know what that is, right? You're too young.
Oh, God, that's sad.
We could have squeezed in the EMS budget before.
What's that?
We could have squeezed the EMS budget before then during the signing period. Rachel, would you mind having that on one of your tabs, just in case Marty needs to look at it during this discussion? Just in case it's referenced during the,
He's got it.
thank you. You want to bring them back up? Or just have the
Well,
agenda?
once she starts talking, it'll come up.
Okay, so I think we're ready. For
Okay.
Elaine and crew.
Okay, thank you. Well, do want to say thank you for the opportunity to meet with you virtually this evening rather than in person, although these day and age, maybe this is the safest way for some of us. That's a whole nother topic. But I am here this evening at the request of Rachel. It was just to let you know, give you a little bit of background. I'm at Gelser Investment Management, and we handle the assets for the sheriff's retirement plan and benefit plan. And on a monthly basis, we run a listing of all the deposits that have been received that include county contributions, civil process fees deposited, as well as payroll deductions. And I report back to Pam at the auditor's, or excuse me, at the sheriff's office. And she then typically runs it past Rachel to say, does this line up with what you believe was sent? Just to make sure that there are no checks out there floating around missing or anything like that. When I ran that list in November, the first part of November for deposits received during the month of October, Rachel returned to me a spreadsheet that said, I don't see all of the deposits that have actually been made. And my response was that her list included the payroll processing deposits and that those are in fact being paid into the plan and they are necessary, but they are not tabulated as counting up towards the total county contribution that's owed for a given year. And her response was, can you come talk to the council? So that's what really instigated this whole thing. I have been kind of gathering some information and reached out to Stan Brown at One America / McCready and Keene. And he said, you know, we're the actuaries. We're the ones that determine how much the county owes for each year. Oh, maybe it'd be a good idea for me to also attend this meeting. So reached out to Rachel. She said, sure, that's fine. So I've asked Stan to also partake in this meeting so that maybe he could answer questions if there are in fact questions about what checks count towards what, how is this running tab processed and all that. So unless you have different direction that you'd like to take right now, that's what I've invited Stan to step in and talk a little bit about.
Okay, so yeah, I don't think we need to go through all the pages of your reports, but we've also been given that added information that you passed us. Thank you for that. That was very helpful as well. Could you explain to us real quick though, why is the accelerated funding or the recommended funding from the actuary, why is that always so much more than the amount required by law?
Stan?
Yeah, I'm back.
Did you hear his question? And
Oh, I got disconnected. I'm back
Oh.
on now.
okay, just to reiterate, if I may, he stated, why is it that the accelerated funding contribution and some of these other ones deemed recommended are so much higher than the one that is deemed the minimum required by statute?
Okay, that's a good question. I think everybody has a copy of the most recent actuarial evaluation report, I believe, that was sent around. That's on page 7 of the January 1st, 2020 report.
Yep, it's right here.
And the difference is the three contributions are calculated using different amortization periods for the plan's unfunded actuarial liability. So if you would just scroll ahead one page to page 8,
Right here.
that gives that shows for the retirement plan the accelerated funding kind of contribution. That's our term. That's done with a 15-year amortization of the plan's unfunded accrued liability. The recommended is done using a 20-year amortization, and the actuarially determined / minimum required kind of contribution is done over 25 years. So it's like you have a mortgage, and one of them is a 15-year mortgage, the other's a 20, the third one's a 25. The 15-year mortgage has a higher payment, obviously, because you're paying off the balance over a shorter period of time, but you also save in interest payments over the long haul because you're only making 15 payments as opposed to the 25 on the minimum. So that's the difference.
So I think the thing that's still hard for us to understand.
Okay, that makes.
So how is the fund itself impacted then? Because, looking at page 36 and 37, I mean, one of the things that we've raised interest over the last several years, I mean, I've personally been involved with Marty and with some of my colleagues here knowing about this over the last 10 years, say, and several years, your earning is in the negative. And so the unfunded amount or the amount in the fund itself, I mean, how does that work against when it's not earning, and I mean, who's closing that gap then? I mean, I one of the things I don't see in your pension plan is there's no guarantees on any earning. And so are we making the correct assumption that when the actuary is on the negative side, that somebody has to close that gap, assuming since you're not doing
some of that
earning, that we're doing it?
Excuse me.
That is the nature of a defined benefit program, where the risk of investment gains and losses is borne by the sponsoring employer. The same thing is true for all of the state-run defined benefit programs as well. And so in years where there's an excess above that actuarial assumed interest rate, there's an excess, there's going to be years where there is a deficit. And so when you say who is to make it up and how is it handled, there are standard processes in place to amortize or to spread those gains and losses out to mitigate some of the volatility that can occur when there's just a snapshot date of December 31st in a given year, to say what are the value of the assets on that day versus what may have occurred during the whole year or will occur after that. So Stan, do you want to talk a little bit about the actuarial assumptions and how the methods deal with that and process it?
Yeah, I got disconnected again. So I heard most of the question. If you go, and you were on pages 36 and 37, if you go to page 14 of the actuarial report,
Yep,
that shows.
Print them all out, but the ones here, yep, we have it.
Okay, that's the asset page where we develop what's called the actuarial value of plan assets. And that's a 5-year smoothing of any gains and losses on the assets. They're recognized 20% in the year they occur, and then 20% in each of the future years. And when I talk about asset gains and losses, what that means is if the plan assets exceed or the earnings exceed the 6 3/4% assumption, there's a gain on those assets, and whatever that gain is gets recognized 20% in the year it occurs, and then 20% in each of the next 4 years. If there's a loss, that means the assets earned less than the 6 3/4% assumption, and the same principle applies. You recognize 20% at a time over a 5-year period. So this is a rolling 5-year average that is recalculated every year. You drop off the oldest year, add in the most recent year. So for the process on the assets, that helps as much as possible with smoothing the volatility in the market. This is a pretty typical method on asset smoothing. They're using governmental pension plans. And so, if you look at page 14, there have been a couple gain years and a couple loss years. It's line item number 9 in this exhibit. And 2019 was a pretty good year. The asset gain was almost $200,000. But if you remember, 2018, December of 2018 was, one of the worst months. In fact, the Christmas Eve stock market had its worst day ever in December of 2018. So there ended up being a loss in 18, a negative rate of return. So we smooth in gains and losses on a rolling 5-year basis to help recognize that the plan assets aren't going to earn 6 3/4 every year. There's going to be some years better and some years less.
Could I just stop you there for 1 second, please? And
Okay.
Please, all of you here that are involved in Merit Board or the Sheriff's Department, please take a look at your report here, because that's very important. This page 14 and page 37, 36 and 37, please look at it. I mean, seriously, this is your guys' future. So explain this to me on page 6 on the other presentation that you sent in terms of retirement plan assets. Can you explain how the accrued liabilities and valuation obviously the accrued liabilities have been pretty flat for us, which is good, but the valuation assets have increased, but somehow the funded ratio, how does the funded ratio keep on, there it is, how does it keep on going down through the lifespan of this fund? I assume part of it has to do with some of the negative earning that's been going on, but like what's going on here? Like is that normal?
I guess what exhibit are you looking at? Is it it's on the
Gelser's right now.
It might be on the Gelser report that shows the mountain chart of the health of the plan per se. Yeah, the black pages. You have that report in front of you, Stan?
Yeah, yours on page 6.
Right.
Yeah, before you start talking about that, I'll add, a little bit of perspective here on to the question. We do our actuarial work every year, and we get new census information, we get salary information, and this plan obviously, has a sheriff as a participant in this plan. But over the last 10 years or so, there have been 3 pretty substantial updates from the Society of Actuaries on life expectancy in this country, recognizing that people are living longer. And in fact, in early 2019, there was a published tables for governmental pension plans for hazardous duty employees like police and fire. And so that's been the most recent update. We're using that table There are projection updates to these tables every year that we take into account. But the big thing to know is that there have been 3 substantial upgrades to life expectancy table, where we're talking, if a group of, it's reflecting that people are living a year longer, or whatever the amount is. In terms of better life expectancy, that results in pension payments being made over a longer period of time. So that's been taken into account over the last 10, 11 years for one, to keep that in mind.
Say that though, but the accrued liabilities really have stayed kind of flat. According to
Are we looking at
the same thing.
Hold on.
is that on page 6?
Yeah. Right? Am I looking at that wrong way?
Oh, wait, I'm gonna get to that page as well.
Going up some, right?
Right. They have accrued liabilities have been at starting around in whatever that year, that 2000, well, you have control of the screen, I don't, in the year 2011 and moving forward. So it was about 2.75 and now it's up $1 million.
Yeah, you could, if you go to the actuarial report on page 18, it gives you the dollar amounts that tie in with the graph from Elaine's Gelser exhibit. So page 18,
Right.
10 years ago, the liability was about 2.7 million. It's up to, at 1/1/2020, about 3.35 million.
Yeah.
Probably not as much of an increase as maybe one would expect, but you also had a favorable demographic experience in this plan a few years ago when a former sheriff passed away, and his wife, who had the survivor benefit, passed away shortly thereafter. That resulted in a gain to the plan.
And so really for you to read that mountain chart, is that the lighter tan is where the accrued liabilities are. And that is showing, as Stan described, it starts off at about 2.6 million or something like that. And it has slight increase. Then from 12 to 13, there's a reduction. And then it starts marching north again. And the assets, however, have remained more level. And so is that where the concern is? Because there has been the increase in the accrued liabilities. There's no doubt about that.
But why do the assets not track in I mean, that's a negative slope from
Right.
2015. It has a negative slope.
Not quite, but close. And one of the things just to say is that there is most certainly the investment performance as being very important. But there's also the need for the contributions to come in a timely manner and in full. And that hasn't always occurred in this plan. There has been at times some delays in when those deposits were made. There were a few years it was running a couple years in arrears as an owed and anticipated to be paid. So
there was one year that it didn't get paid, and that's what really negatively impacted it. But that was like 10 years,
Oh,
Yeah.
Right. And
But then we caught that back up in like 2 years after that.
page 17 of the actual report gives a breakdown on what went in for a particular plan year versus what was required. So there was in 2011, while there were contributions that actually went in during 2011, none of them counted for the 2011 plan year because the plan was in arrears at least 2 years. And so everything that literally went into the plan in 2011 was counting for prior years. And then there have been a couple years, 2016 and 2018, where, a little bit less than 90% of the required minimum went in 1 year, and then about 18% in another year. That was page 17 on the in the
I saw
actual.
page 17. I think what we're just still trying to understand though is how do the assets not increase? Like how does that not have a positive slope? If you folks are
Okay,
making-
one of the things for you to also keep in mind is that if you have a pool of assets that have to be making distributions every year, and you're not going to necessarily be able to keep increasing it over and above if you're taking out more than you're putting in or taking out more than what it's earning. And I think that's what Stan and I were trying to talk about, is that the numbers or that illustration there is not just on a fixed principal that has been tucked away and is left there to take care of everything and just be invested for a long term. That is a pool of assets that has the monthly obligation to pay the pensioners. And so whether, and Stan's comments about sometimes the county contribution hasn't been made in full, those pensioners still got full checks. And so you are depleting from principal.
I have it right here.
When you're not quite mating it. Now, there certainly have been years where there have been negative years on investments. I'm not trying to minimize that. But I'm also saying, don't look at that as a stagnant pool of assets that has been given to a bank and you're told, we're not going to touch it, just invest it. Because that's not really what's been taking place.
I really wouldn't call it stagnant. It reminds me of a fund that goes with a lot of low risk, investments and has just a real steady income. But I don't want to protract this meeting too much. I think the other thing that we do is just understanding what we budgeted and then what we're bringing in, Rachel, and then not able to. I think we want to just talk about where we're at with the hard numbers also. And
Well, for 2020, this is what we are.
that's after we paid the boat money.
Yeah, the riverboat money was the $67,000 and the $33,000.
So minus the 50 that we talked about budgeting, it would actually be 32.
We didn't budget anything.
Talk about budgeting.
Yeah, I'll add the minimum contribution that we determined, we determine the results a year ahead of time. So we determined the 2020 county funding requirement back at 1/1/2019. And so for both plans, the total was $225,493. That's the minimum. And I'll mention, you're probably aware of it, but on the gateway filing that gets done every February, the pension plan information is reported on the gateway. And one of the items that does get reported is, what was made in the prior year versus in terms of a contribution versus what the minimum required was. And so that information is tracked and monitored on the gateway. And that's one of the primary items that gets monitored for the county police retirement plans is whether at least 100% of the minimum is being made. And that 225,493 number is on page 7 of our actuarial report. And then the 2021 number, we determined here at the start of 2020, and it's just slightly up, 227,668. I would mention that I believe the department was down an active officer in headcounts from as of 1/1/2020 versus 1/1/2019. So that'll get caught up here when the census for the year in 2020 gets reported. But for budgeting purposes for 2021, the number we show on page 7, or the numbers, are good. They're not going to change.
Can you take a look at page 37 and explain to us what the ratio of actuarial accrued liability to payroll means? And why does it take that dip in 19 and 20? When it's been consistent the prior decade?
Let's see. So you're talking from 2018 to 2019?
Yes. What drives that?
That literally is just a calculation of the liability for in the plan to the payroll. I'd have to look at it a little bit closer. I think. See. Yeah, see, the payroll had a pretty sizable jump from 18 to 19, went from 536,000 to almost 590,000. So that makes the denominator of that fraction bigger. That would be my first inclination, but I could take a look at it and provide a little bit more detail in an email to Rachel.
Actually, you answered my question. I had Rachel pull the numbers out for me, and I have those added up here, and I just wanted to confirm that that's what I was seeing as far as that. Well, I'll defer to the rest of my colleagues here in a second. I don't want to steal anybody's thunder, as well as Marty. But obviously, we're not in the best of situations already with our budget. It's probably no surprise to you, but I will tell you that I've been speaking with the governor's office as well as congressional leaders. Marty's been aware of some of that as well, but to try to see if there's some kind of relief for small, just underfunded counties like ours that don't have a lot of industry, because it turns out that a lot of my colleagues across the state that there are several in similar situations, and most of them are actually working with you folks as well. So, and I will say though that we're not alone. It is a common theme with your plan, having some negative numbers, and just definitely not, I'm just going to say flat out, definitely not what I'm seeing with other investment plans. My personal one, for example, that's another thing that we can, in fact, we should talk about having the merit board
Yes.
agenda, just so we can talk to the merit board next.
That-
Follow up with some of these findings and figure out where we're, about the money. But with that, I'll pass it to you guys, unless you think that we've covered a lot of the.
And if I may just say, we would be very happy to sit down at a separate meeting and talk with you, explain with you the investment policy statement that's been implemented and put into place, so that there are boundaries and there are directives of exactly how things are to be invested, particularly given the volatile economic conditions that we're in right now, at your convenience, members of the county council. Be happy to do that.
Well, I just have to say personally, for me, it just hurts me sometimes when I see what some of this looks like, when I see some of their earnings. These guys are my friends, they're people that hopefully I'll know, all my life, and there definitely they need some help with this for sure. The numbers are
right. And let me mention also, to just sort of to differentiate roles, to make sure, One American McCready and Keene, we prepare the actuarial reports using census information and data and the asset information. But we don't get into the side of investment policies and so
That's
forth.
what we do.
We leave that to the experts like, Gelser has it now.
We understand that. Yes, thank you.
Right.
Yeah.
Marty, do you have any?
Well, I guess I do have one question is, one of the factors here is the longevity issue. That's affecting everybody, correct?
When you say longevity,
Life expectancy,
How long people live, longevity.
right? That absolutely. And as I mentioned, there's been 3 pretty substantial updates in the last 10 to 11 years. The most recent one, which was made at the start of this year using the public safety tables, wasn't as large of an impact as the previous 2. And as I mentioned, we get there are updates every year to those tables based off of the most recent experience. And the last 4 updates on mortality projection have resulted in showing that people are not living as long as what these newer tables projected. And so we get that gets recognized every year. But the tables still that are out there now are still reflective of a longer life expectancy than tables that were used in the 90s and the early 2000s, for sure.
Well, in any event, the longevity applies to every similarly situated.
That's exactly right.
Right. So this has been a problem with them too, correct?
Yeah, absolutely. And I mentioned this plan had the death of a prior sheriff who was drawing a benefit.
I understand that. I really would just like to stick to the subject.
Right, I understand that, but other plans had that happen too. And so, these plans are small enough where one event like that can have a pretty substantial impact.
All right, but regardless of the unique situation here, the longevity has affected pension plans throughout Indiana, correct?
Yep,
Yes.
absolutely.
Okay,
And
so how are they responding to it? How are other communities responding to this?
I think some are faring better than others, and I think it's already been stated what the industry is, what they have within their community, and how it has
You don't
fared.
have any statistics on the effect on other similarly situated communities, small counties, for example. I don't just want general, statements. I would like to know statistically, how has it affected other similarly situated communities?
Stan, that, and allow me to say that is what gateway data is there for.
The answer is you don't know, I guess.
But, well, I think Stan probably knows, but it may be a proprietary thing that you're not able
Somebody
to.
knows, we'd like to hear that about how we fare compared to other similarly situated communities.
Especially.
See, this is important because, Mr. Pearman is trying to work with some of the state government to look for some relief for, counties like this. And it would be helpful to know, I think for the public to know, whether we're especially affected by this or whether this is, broadly affecting rural communities in Indiana, which is what I'm going to guess based on what you said.
It is. All 92 counties have county police plans. The retirement plan here is at a 64% funded basis based on how governmental plans are measured. There are, that's not an uncommon place for counties to be, especially counties, in your situation, maybe with 12 to 15 deputies and so forth. And so, a lot are being impacted by this. There are some that are, better prepared to and a little bit better funded. They have more resources to be able to fund the recommended contribution without difficulties. And when you do that over a long period of time, you get better funded. It takes a while, 1 or 2 years, 5 years, that's not going to do it. It's a sustained, putting in the recommended and having solid investment years, and that takes time. But your plan at the 64% funded, and again, that funded percentages and funded ratios, you got to understand the connotation that they're used. In this particular basis, governmental plans get measured the same way. And we'd like to see it a little bit better funded, but it's not in danger of not being able to pay the pensioners. And this is a long-term entity, is how it's viewed.
Is it possible, I mean, that, I appreciate that, that's really helpful. Is it possible for us to see statistics that compare the performance of the investments that this, that our pension fund has been getting compared to other similarly situated ones, so we can try to determine whether that could be handled better, or whether it's just what the situation is. I understand how you calculate that 5-year rolling average, and one thing that was helpful
Right.
that you said that you have a benchmark of like 6.5%, I think you said, or 6.25%.
6 3/4.
Quarters, yeah. And so it's actually
Absolutely.
it's considered-
The gateway reporting has all of the actual numbers, the rates of return. That goes back 7 years. On the gateway, you can create your own report for each individual year and download it from the state's gateway website, and have it in an Excel file, and you
Sure,
can
but
absolutely see.
You don't know those. You don't know those off the top of your head, or you don't watch that stuff. Okay, thank you.
Yeah, I mean, we do. I mean, we track it and so forth, but that's where it's available to the general public for sure.
Well, I'm not an expert in doing that. I thought maybe you were.
Anybody else? So that'll just be our plan moving forward. Thank you for all the information. We'll use this to take into consideration and try to look at different charrettes on how we can move forward. We'll add merit board to the next meeting so we can talk to them together. I'll get into Gateway too and see about those numbers and look different ways. And so thank you.
All right. Thank you
all.
very much.
You're welcome. Thank you.
And, I think that, since it's been some time, has everybody hung up?
Yeah.
So, and I think though that it's worthwhile to at least recommend to them. Hopefully the state will get back to me with maybe some ideas that they have that we can present the merit board with some ideas, because to dig everybody out of this is going to take legislation. We're not going to do this on our own. But they need to help us with it, because we need law enforcement, and, and we've gone through the whole thing before, that this is one of the retention assets that the sheriff's department uses, having a pension plan. Now, there might be other plans, and we've seen them before, just to look at, but it might be worthwhile to the merit board and the deputies, again, to look at other plans that are earning way better. And I'm just telling you guys, they're out there, but it's your money.
It would be really nice to see, how we're performing compared to similar, places.
And that too,
We
yes.
might be doing better than most.
We might.
I mean, I wouldn't rule it out.
I know we're funded higher because I looked
Yeah.
at it before,
Yeah,
but I just didn't
it
pull it up
doesn't
this
mean that
time.
it couldn't be funded better or shouldn't be funded better, but realistically, but I think you're right. I think that that your effort to try to get some relief to rural areas from the state, we don't have a gambling vote. I mean, those kind of, and I kind of personally, I don't really like seeing the economy, counting on big gambling
No.
funds.
We have to look past that now, because that may disappear.
Am I correct that out of the past 5 years, 3 years has been a negative gain?
Yes.
Well, that's something we need to find out, is statistically, is these other investment companies, are they losing money 3 out of 5 years? In the last 4 years has been fairly good to the markets. So that's pretty negative right there. When you're losing, 3 out of 5 years, you're in the negative.
Well,
That tells me something about who their initial, somebody's buying and selling them stocks. Somebody's not doing a very good job of buying and selling those stocks for these guys.
and that's why my first question was around that, and she admitted that was true, that basically when they have a bad year, then we make up the gap. The county makes it up, and that's the part that's not fair. And there are pension plans out there that are guaranteed also, and they eat it. They eat a bigger part of that. So anyways, we'll dig for more information. The DLGF had given me a little deeper access for some read-only abilities and Gateway. So I'll get some stuff dug out and get it sent out before the meeting so we can look at that too. But
I think there's got to be possible to do a more useful analysis of this situation than what we got. just now.
Well, the good thing,
I'm really
the good thing
honest
is when
about
I was on the call the other day with the senators, it turned out there really are the same kind of issues, in other counties and equally as bad with issues of questioning the poor earning and other things. And so it's hopefully on their radar screen, because I had brought it up with the governor's office too. So hopefully we can help the sheriff's department and the deputies, get something better out of this. But is there anything else? If not, we'll move on to the EMS report.
We're going the wrong direction, Jack. Paper. Well, I don't know what we need to do with this. I'll just give you this. This was an O'Hara check, and I usually give it to, or if you want Dave to
Read that, Dave.
just read it, Dave. That's from our collection agency in November. And that's how much we received. That's just.
All right.
Charlie,
EMS
you did it.
received from the O'Hara collection in November, $577.29, $577.29.
So far, yeah, just give it to Rachel. Thank you.
Did there's small things in there too?
We didn't get
You
any.
didn't get anything?
We didn't get any. Which I could check over there. The mic check's sitting there. She usually lets us know. Okay, here's my my normal report that I usually give the commissioners. And it kind of just tracks how many runs we've had in the month. And this month we've had, or how many billed runs. But it's usually I go to the end of the month, like maybe in this total might not be the last days of the month run. That'll be in November, but it's electronic, most of it. So, and I've been working at home and it's been great. They've been sending it to me. So we're up to date. So 181, the percent on the bottom is how many of that 181, what percentage does the hospital actually generate for us? So that's a big part of our revenue, the transfer truck, the transfers out of our county to help these people in this pandemic or whatever. But that's been pretty consistent, pretty hot, a little bit different, but pretty consistent since we've started the transfer truck. The next sheet is just, that kind of breaks down what money is being processed, like the older accounts, the newer accounts, what was collectible, what's sitting. And then the last part of this is the revenue from, and we're comparing it to 2019. And what you have to remember is we started the transfer truck in March of 2019. Our revenue went up considerably all the way up to February of 2020, and then the pandemic hit. And from that point on, you can see our revenue has dropped. So that being said, the third sheet is just.
Hold on just one second.
Sure.
Is there somewhere that shows year-to-date 20 versus 19?
I can tell you how much money we have there.
Can you get with Rachel or whoever, so you can change this report so it has, like our reports where it has, wouldn't that be helpful? Does everybody think prior year was there? Those numbers don't really tell me much unless I have something to benchmark it against.
Well, but you're right. The prior year's right. 219 is right in this column.
Is
Is
it
that what you're
total?
saying?
Yeah, and then she's showing,
Right here.
Right.
I'm just telling you the difference in the
Where's-
month. You want a running like the total. I do month per month per month.
Yeah, it'd just be nice to know year-to-date if we're making money or not, or if we're negative.
Okay.
If you could just add
We're
that as
probably
a
Okay.
box even, it doesn't have to be a column, but I just,
year to date.
and I do
Okay.
have that in my report.
He has
as
it in
well.
his report. This is my normal report.
I think for us, it's more important, the bottom line, like
Yeah.
we appreciate, we want you guys to have a lot of
It is.
runs and things like that, but honestly, it just comes down to the dollars and cents
Right.
for us.
That's gonna be this section in my report. I think.
Okay, good,
Right.
because I know
And-
Brad had asked for a separate report
Yes.
previously about just what the transfer rig and
Right, and we
was it
get
above
that.
water? Okay,
But
good.
just so if you want a running total where we're at as of tonight or as of today in our, what we brought in the year, we're at 827. So that's,
So-
yeah, so that's not actually you know, we were at 1,000,001, 32, you can see last year, but that was only 7 months. And that's what Travis is gonna talk about, the transfer truck. So we could project to be at about 950 by the end of the year. So I don't believe we'll get to where we were last year, but there's no way, you couldn't predict what was gonna happen the last
Right.
8 months out of the year.
Well, it's just our budget, you know, now that we're in super budget crunches, obviously for us, revenue is a big factor. So that's
I
why
know.
I'm asking for those numbers.
Yeah, we understand that, but, you know, in a pandemic, that's probably not the time to be looking at, you know.
Well, not actually pandemic,
whatever.
non-pandemic, anytime, you still have to make budgets. So that's why I'm asking that. But that's all right.
Okay.
Go ahead.
But anyway, so then Travis has his report.
All right, so the next page here will be my normal monthly report that I do for the commissioners. Obviously, again, we're here this month, third Monday of the month. So operations wise, our operations continue to run smoothly. We continue to operate the 4 ambulances out of 3 stations located throughout our county. We have 3 24-hour 911 ambulances. And 12-hour transfer unit during the day. The transfer unit seems to do just as many 911 calls, mainly in the California and Center Township area. That is our busiest, most populated area. The transfer unit also does many coverages for ambulances as needed. So if Medic 5 is transporting a patient, 911 patient from Plymouth, they might sneak up to that area, and vice versa for Medic 1, maybe taking somebody to Pulaski or Stark. Personnel wise, it's been a little rough. We've had some challenges over the last 2 to 3 weeks. It's no secret our area is being hit hard by COVID-19. We're also being affected by that. I've had some paramedics and EMTs, specifically 5 full-time paramedics on quarantine, 1 full-time EMT on quarantine. We've also had an EMT full-time out on injury that was not work-related, but she's unable to come back until December. I've also had several part-time EMTs and paramedics that have been on quarantine.
What triggers quarantine? Is that if they have a patient or if one of the coworkers was positive?
Actually, positive cases would be.
So that's isolation, not quarantine.
Isolation, yes,
Oh, okay.
yes. So,
If they come in contact with somebody, all right, we had a call the other day that was a COVID positive.
Mhm.
They go into that house with that person, do they have to quarantine that or?
absolutely not. I mean, we wouldn't have a service if that
Not
was the
quarantine,
case.
but,
Yeah, that's why, that's isolation.
Yeah.
It was
Yeah.
not-
My
that's-
apologies.
That's why. I
because
was
that doesn't
afraid.
make any
I
sense.
thought, gosh, if we're
apologize.
doing quarantine, we're,
No,
Most
my
part-time
apologies.
people like that within 6 months, 15 minutes or more, then it would be recommended that they quarantine.
Right.
You get starting into essential personnel or anything like that, then it's a matter of, as long as they're asymptomatic and they don't test positive, they can continue to perform their duties.
Right. Obviously, we're picking up COVID positives daily.
yeah,
That's
I was
where
gonna say,
PPE
gosh,
comes
we're gonna
into
run
play.
out of personnel.
I did just kind of a show and tell for you guys. Instead of doing the N95s, we've had so many issues lately that I went with the Ellipse P100. Supposed to filter out a lot more, obviously viruses, bacteria, 100% basically instead of the 95% of the particles. So we did switch that recently. Obviously, our paramedics, when they go to the or EMTs, they're wearing gown, goggles. They should be wearing this mask or an N95 if they're a part-time employee. Gloves, obviously, so like Frank said, we're exposed daily. It's not really an exposure though. Again, we're in the proper PPE. If we had to quarantine everybody, we wouldn't have a service because we're
Right.
picking them up. Literally, we just ask people to wear masks at this point.
Those masks, are they filtered where you can change filters?
Yes,
and
yeah, the
so-
filters can change out. Filters are $5 a piece, $10 per mask, and then the mask itself is about $25. Local company in DeMott, Indiana, manufactures it. So it's kind of nice that it's within driving distance. I can run over, grab them.
So you're
filters.
staying up on the.
Yeah, I think in the long run, this is
The
going to.
employees are being treated as safely as possible.
Absolutely. Yeah, we're doing the best we can. Now we're wearing them on pretty much every sick patient. And even sometimes lift assists, you might go lift them up and now they have hip pain. We transport them to the hospital, completely obsolete with what's going on, but we come to find out they're COVID positive. So we're trying to just be as safe as we can. And again, this was one of the steps we took was better filtration through the mask. So as you can understand, personnel has been rather difficult lately. I've been on and off the truck as needed. I worked a 24-hour shift last week, a couple 12s the week before that. But I think things are starting to stabilize out again. Training wise, in-person training, it's obviously difficult for this time. We had to cancel a few in-person airway classes. We also had to cancel our cadaver lab that we do pretty much yearly with Memorial Hospital in South Bend. We switched to a virtual audit and review with Stark Hospital. Audit and review is done monthly with LaPorte and Stark Hospitals, our medical director, Dr. Maravich, and our EMS coordinator, Dale Lanham. We review patient care charts and figure out how we can improve with our patient care protocols. And continuing education is required to be kept up even throughout the pandemic. So again, we're trying to offer some unique trainings this year virtually. Again, it's hard to get hands-on, but our paramedics need approximately 60 hours of continuing education, and EMT is about half of that. So if we average about 10 hours per month in required training opportunities, they need to be at least 5 of those 10 hours. Safety-wise, we had an injury-free month in October. Ambulance maintenance, 0514, which is our Grovertown ambulance, had 4 new tires put on at Sherwood Tire in Plymouth. 0514 also went to the Ford garage in Knox for some DEF system related issues. I'm actually really pleased with having Knox as an option now with the DEF system issues. Obviously, the Chevy dealer here in Knox didn't used to do that. Most of our diesel trucks are now Chevy. But when the DEF system went down, you had to transport it over to Plymouth somehow, whether it was finding another crew member to drive it over there, bring it back. So it's really nice having a diesel tech here in town that's willing to work on the DEF system. So we've had great luck with them. They're able to get us in and out quickly and get the problem resolved. 4230, which is our 2019 ambulance, it was serviced at the Ford garage. Again, it's serviced there because it's still under warranty. We had 0514 service this morning at our county highway department. 84 is scheduled to go in later this week, and our newest ambulance 3308 will then be in 2 weeks after that. The work's being the services on our newer gas engines. I just wanted to touch on that. It's been nice on the budget because again, the oil changes is pretty much all we've done on the 2019, 2021 now. $30 to $40, and it's in and out in about 30-40 minutes. So that's been a huge plus for us. Base maintenance wise, we had no base maintenance issues for the month of October. LaPorte Hospital Move Day, we did participate in that. We brought in an additional $1,500 from doing that. That was on Saturday, October 24th. We took an ambulance up to their facility, their old facility, transported patients over to the new facility with the commissioner's approval. We did not take any resources away from Stark County during that time. We actually, myself went up there and we just paid an EMT, I believe, 5 hours of straight time at 12:13. So we pretty much netted $14.20 for the day. So it was a neat part to be a part of that historic day. And again, trying to keep up our relationship with the hospital, help them out in any way we can. The next page here, you guys will see a STEMI feedback. I've never really brought this to anybody, but I just wanted to show you guys how cool it's been to have our new monitors with what we can do with LaPorte Hospital, Porter Hospital, Plymouth Hospital, South Bend Memorial. We have them all set up, but this was a patient. There's no HIPAA stuff on here. This was a patient that I personally picked up last week and was transported to LaPorte Hospital directly from their home. We were able to transmit an EKG up to LaPorte Hospital, which was our closest cath lab. We found out the patient was having a heart attack. Transmitted it up there. You can see all the times are great. STEMI was activated. I was able to jump on the cell phone then on the way to LaPorte, talk to the cardiologist and the ER doc directly. And then this patient went directly into cath lab, and you can see the pre and post. And we hit all of our times besides the fact that we came from the Bass Lake area.
Yeah, they were in rough shape.
So this is kind of a partnership again that we're doing with LaPorte and Porter. They really give us a lot of feedback. Those are our main places we go. I'd say 95% of our STEMIs, heart attacks, go to LaPorte Hospital, but there is a small percentage we take directly from the scene to Porter as well, from the same peer area. So yeah, it's really neat that we have this capability with our new monitors that we got a couple years ago. We're able to kind of set up some technology things, and it's all about that door to balloon time. And time is muscle. So I wanted to show you guys and share with you that. And then the last thing was the kind of breakdown that Dave was just talking about, whether or not the Medic 2 truck is making money, making revenue. So we got our projected costs, which were well under budget. What we did too with the payroll, which is obviously the largest point of concern there, would be we took half overtime, half straight time, which would have been $156,942. We have not been paying near the amount of overtime that we had projected. Again, we just wanted to kind of give you a worst case scenario. So the actual cost you'll see there in the middle, $100,497 for payroll. Everything operational cost for a full year with April to April of 2020 is kind of how I put it, was $121,154.72. And then you see 2016, 2017, 2018, and 2019. You can see there's this considerable jump in revenue the first 7 months of the Medic 2 and kind of taking some more transfers and outside of the 50-mile radius. So we ended up bringing in, as Mary Lynn already touched on last year, 1 million, almost 1.2 million. So in January and February of this year started out great, and then obviously pandemic hit in March. So
We were on the same kind of revenue stream until March.
yeah, and we'd projected about 417,000 net income for the year. So I think if we would have kept going after those 7 months, we would have been very well close to that.
Right.
So we're pretty much close to running in the black again if it wasn't for kind of the circumstances going on now.
Right.
So hopefully that helped answer some questions on where we're at. It's kind of a quick, easy breakdown, I guess.
I don't want to preempt any like CRF funds coming down the road or anything like that, but I just have a question about the bases.
Yeah.
In your opinion, are they comfortable for staff? I mean, are they in, I mean,
I think our Medic 3 and Medic 1 base, which is Knox and North Judson, are I don't think there's minimal issues. Now, our Medic 5 Grovertown base, it's had issues for quite a few years. And I don't think, I know Brad's went over and took a look at it. I don't know if anybody else has. I think some commissioners did maybe a year or two ago.
I just
It
want
does
to
need some attention.
I want to make a recommendation though, if CARES money does come through, there's another 22 million. I don't know what the state, they haven't really earmarked or, they're talking about things, but I think that the CARES committee should look at the ambulance bases the next time. Because I think that plays a critical role in
But Grovertown is the insulation.
providing service. So just a note for our committee.
All right.
Does anybody have any questions for EMS?
All right, guys. Thank you.
Thank you.
Appreciate it. The next item on the agenda was the pay rate for the nurse in the health department, right?
Brad had asked at the commissioners meeting, as far as trying to get hold of some information in regards to what pay rates were.
Yep.
All I was able to find was like 2016 pay rates, and trying to base anything off of counties our size, anything like that.
But there was a
2016.
range, right? It's not on our agenda, but what was the range again that?
In 2016, they were getting paid what I'm getting now. So 23.43 an hour. They were getting around that range. Spoke with Marshall County Health Department. They were trying to contract with a nurse so as that they wouldn't have any insurance or anything like that. And at $25 an hour, they weren't finding any takers. So as far as the few days that I had to take off, Katie Jordan came in and helped out a ton. And I just paid her 23 bucks an hour. So just the same rate that I'm making for the most part for her just to fill in while I was gone. And while I was gone, I was still on the computer, on the phone, the emails. But
And
that pay range, I mean, that's,
so is that what our goal is, to establish in the salary ordinance, a part-time nurse rate? Okay.
what it's been in the past has been like 17, and then I add 3% to it every year because I used to just get what the pay rate was from the auditor's office. And now that's what I'm being told is figure out what a pay rate is.
Right. Well, I mean, that's more of a per diem because you're not giving them any benefits. So
Yeah.
this is just like an emergency, like you needed a week off, essentially, right? I mean, that's what it was.
Gone for 4 days, yeah.
4 days off or whatever. Like that would be just so everybody understands what we're talking about
But
here. It
right
was
now,
just
this
an
is a matter of
extreme-
me being off. I need
Right.
somebody helping me now. I had 127 cases last week and I didn't get hold of half of them. It's just, they're coming in so quick. Today, what I got is 23 or 27 cases.
Now, when you say that, Frank, they're asking you to do COVID tests or,
Not asking to do COVID. These are COVID positive patients.
okay. that you're
And I'm
doing.
at a point where I've been prioritizing who I'm calling. I'm
That's-
trying to get hold of parents of what I think may be school age kids. I'm trying to get hold of older
Oh,
individuals.
so you have to follow up on the tracing. I think that's where just, no, I think, right, you're just trying
The
to find out
state,
what.
yeah, the state system has been not doing well in
Right.
regards to making contact and letting people know in regards to what the isolation times are, what quarantine times are. That's been from the get-go. And now they're completely overwhelmed, which I don't understand. They spent $540 million on this MS Dynamics to do contact tracing and investigation, and now they're overwhelmed and they can't get to them. And so they're just cutting them loose after 48 hours.
So you found some money how to pay the previous that we were gonna have. So how
I
much
have
money do we
money
have?
in
You
the
have
health
money.
maintenance
Yeah,
fund.
yeah.
I have like
This is a-
$2,700, something like that, that I budget for that every year for part-time nursing.
Yeah, this
As
is
a
a
just
hit
in
group
case.
funds.
Right. Well, yeah, I mean, the health department's kind of unique on it's
Mhm.
kind of like the highway department on some of those things, but,
I've asked state in regards to being able to use what money I've saved over the years from grant money, as far as what I need to submit to use that for nursing equipment. And I have not got a response. That's been a week and a half ago that I emailed that.
so do we have a part-time nurse created in the salary ordinance now?
No.
Okay.
What are you thinking for a range, Frank?
I don't know. I mean, I need help like at least 4 days out of the week. That would be helpful.
I
But
think you're
mean, as
talking about
far
a
as-
range on the hourly rate, right? Is that what
Right.
you were asking?
I could care less right now. I need the help. So if I'm making 23.43, nobody's gonna come work for $23 an hour. I've got people that are willing to volunteer. However, volunteering leads to liability and HIPAA issues.
Right.
So I'm looking out for county as well as the health department, what have you, in regards to, I don't want just to work off of volunteers because I can't depend on when a volunteer is available. And I have 3 individuals who have called and said that they're willing to help out and that kind of thing, but it's going to be limited on to when they can help because they also work full-time jobs at the hospital, which right now they're needed there more than they're.
But your medical director is willing to cover their malpractice then under his because he's our medical director, obviously. So is he going?
He is the health officer.
But he's
gonna be
willing to
covered.
cover these volunteers? Okay.
I don't want
Because we don't have a
volunteers.
malpractice
This is
policy.
me. I don't want volunteers.
Okay.
As running the department, I don't want to deal with that liability.
So, but you already paid somebody $23 an hour because you thought that was a
She was a
fair.
county employee. We hired her and paid
Her
her $23 an hour.
her pay rate, it hasn't been set yet.
Commissioners passed an emergency order as far as me being able to hire somebody at that point in time.
We hired her, she worked, there's no pay to go with her yet.
But you told her she was going to get 23. I just want to make
After
sure
talking
we
to
manage
Kathy
that
Norm,
expectation
and
here.
she said for me to decide what a pay rate was going to be, and I
Okay,
just.
'cause
that's
I know
after
Kathy
talking to
sent us a
Rachel.
range of 21 to 23, I think is what
And
she
that's
said.
after
so.
talking to Rachel. She's an RN, I'm an LPN. And as far as to get her, she was, again, same thing.
Does that sound good to you? 25, 21 to 23 is the range?
That's fine. I don't care. Like I said, right now, I just need the
Then
help.
you got the leeway. If for some reason you want to make it lower, you can. I mean, that's just what we normally do with.
If I can make it lower, I'm not gonna get anybody.
Is that
I don't think
a
I'm gonna get anybody
Is
at
that a
23.
motion?
Well, I guess it doesn't have to be an RN. You can use a LPN.
I'd just as
So
soon have
it's-
somebody with a nursing background. That way they can answer,
But I
they
mean, an
at least
LPN
have.
would be sufficient.
LPN's fine. Yeah,
Okay.
LPN, RN, whatever.
I mean, right now you're talking phone calls and I mean, like, you're going to still be the
They are
the
gonna have to
main
be
nurse.
approved. Yes, I'm not
Right.
looking at anybody to take my place, but as
Right.
far as doing contact tracing and that kind of thing.
Yeah, I
just-
mean, it's a
need-
government job. I mean, so like,
I need
you
the
know,
help right now, but I don't have the money for.
is that a motion?
Yep.
Is there a second?
What is it?
23.
Make it 21 to
I-
23.
I'll make-
21 to
I'll
23, and we have a second. Is there any further discussion? Howard, I didn't mean to cut you off. But I just
No,
wanted to get that.
I think we came into this a little bit not sure what you were
I know.
asking
Yeah.
for, Frank.
And that's it.
And when-
I haven't
but
really
can-
had time to
right.
be able to.
And I understand, you needed a week off.
Any other,
I mean,
any other
and-
time, I'd give you better numbers.
And,
But
right, in this,
I just don't have access to it.
it seems to me with the advanced and the growing number of COVID-19 you're dealing with, you're overwhelmed and you need help. Am I stating that correctly?
Yep.
Okay.
We have a motion, a second. All those in favor?
Aye.
Is there any opposed? Motion passes. Thank you. And Frank, thanks for your hard work too. We appreciate it.
I appreciate you guys.
Get some rest, Frank.
Yeah, I have to give that.
Okay. Mandy? I've obviously already talked to you about this, but this is not a real additional, this is from her fund. So she has to come to us for this. Right. We don't like real additionals.
So, I'm just, asking to be able to pay the November and December bill for our Laredo. With COVID, I budgeted for like what we paid in 2019. I did a little more. But with COVID, since we were closed, our Laredo is our like internet access to our records. And so when we were closed, our Laredo subscriptions went up and. So
Because you had more users during
Yeah.
that time because you weren't just accessing
Right.
it from it. Is there a motion? Have a motion. Is there a second?
Yeah.
I'll second it.
Fred beat you, sorry, but. All those in favor? Any opposed?
anything.
Thank you.
Sorry you had to sit so long for that.
I'm sorry. I'm not sure.
And then the coroner
Can I
is,
just say, so
yes.
it is a real additional appropriation, but your addition, just for those of them that don't know,
okay,
the additional appropriations that are done in county general affect us far greater than additional appropriations that are done in funds like these.
Right. The recorder stands alone, like the assessor and some other departments with some things. The coroner, I think a few people have also talked to the coroner about the fact it's just the autopsy
Hold on, let me go to transfer.
is really hard to forecast,
You threw me
the
off with
coroner's
the
department.
additional, you know?
And nobody listened to that anyway, so.
Don was looking at me, he listened, Howard was
He was
listening.
thinking,
Can't hear.
he was thinking Rachel is making this meeting too long.
What is the, where's he transferring what?
He needs autopsy money.
Make a motion, we make a reduction in office supplies, garage and motor, gas,
Second.
oil and lube, education and seminars, EMA director, and transfer that into autopsy fees in the amount of $4,743.99.
I have a
Second.
motion and
And I'll
Fred beat you
second.
again, Kate.
All
Sorry.
right, Freddie.
Oh, do you know, I'll let you
All
know.
those in favor?
Aye.
Is there any opposed? We'll move on to the sheriff's department. I'm gonna move the grant.
Yeah, that's fine. You want to do the.
Are you doing the grant
Yeah.
first, Dave? or you
Yeah,
wanna
let's do the
that?
grant first. If she's got it. Well, no, she's got the transfer up first, right?
Yeah.
I don't have paperwork on it.
From multiple things into multiple
Do
things.
you want me to do this, Dave?
Sure.
Yes.
Make a motion, we make a reduction in radio, what?
Systems.
Radio systems, CAD, computer paper, 911 service contract, and move those to extra help in the amount of $1,500, overtime in the amount of $2,300, NIPSCO in the amount of $500, and extra help in the amount of $5,000.
You check those in 21.
There's your motion, Dave.
You have a motion? Is there a second?
I'll second it.
A second from Kay. Is there any further discussion?
What,
You
I
bet.
got a question. Your extra $5,000, Sheriff, what, was there a certain specific event that happened that you needed for extra help?
For dispatchers.
That's to cover dispatch. So we had one dispatcher off for 2.5 months with the COVID.
Oh, I understand.
Yeah,
Okay, I
so
just,
we had to cover
I
that.
figured there was a reason for
Yeah.
it. Yeah, okay.
And on the discussion too, I just brought up, I want to look for 21 about the CAD and about the 911 service contract, because if those don't need to be budgeted, I don't remember if you budgeted them the same, but if that's $7,300, that can help us out possibly. So it doesn't really affect you directly. I mean, because those are things that are paid, you know what I mean? So,
Leave it there.
all those in favor?
Aye.
Is there any opposed?
Tired.
And then, did you want to move the grant to the end, or do you have the paperwork? Or not the end, but after the transfers, or Rachel said she doesn't have the grant paperwork.
The only paperwork that I have on it, I actually sent to, we had sent them before and then it got removed. And then
This
we
is the
sent-
same thing,
And then we sent it, yeah, to Kathy.
because we do have a hiring freeze in place, and I believe personnel period, if it'll pay for an existing person, that would be great. But as far as hiring anybody new, even if they're paid with a grant, I don't believe we're in the market for anything like that, because we have to sustain it post-grant. And
Is it full-time or part-time?
It's a full-time position that was approved before they applied for the grant by the commissioners. So now we're just in
this is the one about
the 1006 grant.
but is that the one where the mental health person is employed by the sheriff?
Right, right. So instead of employing Porter Stark, we would be employing an employee full-time.
See, I don't know, personally, I just don't know why we don't, it's already tough being in an EMS game, the hospital game, and we want to get involved in mental health. I don't know why we would want to do that as a county.
When did the commissioners approve it?
The date on this letter is July 13, 2020.
Wow.
So when they applied for the grant, they put in that this is how they're gonna do the mental health. So if we don't implement this, then we don't have the mental health program because we can't go back on the grant and say, now, we're not gonna do that, we're gonna hire Porter Stark.
I hate that we're getting into the mental health game.
Will it pay for itself?
Oh, yeah, 100%.
And then for how many years is that?
1 year.
Yeah, see, that's what scares me. I mean, who's gonna pay for the benefits on the person after the first year? We just go back to Porter Stark then? And
The
Beg
1006
them to
grant
come
they've
back.
had now for what?
Oh, gosh, 6 years?
Yeah, so they resubmit it every year. Chuck Phillips does it and Nathan Cudell does it, but they get it every year.
And this is an employee, not a contractor, right?
This is an employee.
And so the grant doesn't allow for you to hire a contractor? They force you to make it a employee under the sheriff's department?
I have no idea how that would work.
I'm guessing the way they wrote the grant, it's an employee. That's my guess.
Is this person typically a certified social worker with a college degree?
She's got degrees.
Yeah, she has a master's degree. And then we would go from, like, right now, Porter Stark comes into the jail for 9.5 hours a week. We'd go from that to 40 hours a week.
But we already have somebody picked out and we haven't even approved the position?
She currently works in a different grant position and she's applying for this one.
A different mental health grant position?
She works part-time under a different grant that Chuck has going. I'm not sure the number it's called.
But in the event that this grant would be taken away from us next year, understanding with this, with COVID-19, we just don't know where all this money's gonna come from. In the event that this grant would be taken away from you guys, us, the county in general next year, does this person understand that possibly we may need to eliminate her job and revert back to Porter Stark?
Correct. If we don't get the funding for her, we wouldn't get the funding for Porter Stark either.
The ILP program would be going.
The whole program
The
would be
whole
gone.
program, yeah.
It's just not this position. It's a lot of the programs that we run within the jail
Okay, so I
is under this 1006 bill,
okay.
or grant, I'm sorry.
So, but what does that mean then? You could go back to the old programs?
It would have to be when they rewrite the grant, they have to submit how they're gonna supply the education.
Okay, so this grant was rewritten specifically to hire another employee. I wish there was a mechanism like for the commissioners to work with the council on that before we create new positions anyways. I mean, usually when it comes to salary ordinance and creation of positions, the council has a role in that. You know, I feel like this is kind of like cart before the horse, but it sounds like we don't have a choice. If we don't do it, then we don't have a mental health program. But, I mean,
And it is a year by year.
Do you agree?
basis, like you
Yeah.
said.
Yeah, we do it every year.
You want a motion, Dave? Sounds like we don't have much choice.
I'll make a motion, we approve it.
we have a motion. Is there a second?
Go ahead, Jane.
I'll second.
A second from Kate. All those in favor? Aye.
Aye.
Is there any opposed? Thank you.
Is the Purdue contract coming up too?
I mean, it's okay with Dave. And the commissioner.
Yeah. Yeah, the only thing I'll say for the future, and I don't mean any disrespect to the commissioners, but in the future, when we create new positions, do we think we would at least schedule that and also with the auditor? Can we schedule those decisions in joint meetings and put those together so we're both on the same page? 'Cause I hate it when we're held to, you know, if you don't approve it, you don't get it. Not that you guys did anything dirty, nor did the sheriff's department do anything dirty, but this puts us all in a bad spot. especially now, when we leave this meeting, when the council leaves the meeting, you know what everybody's gonna say? You guys said you were doing a hiring freeze. And just let somebody else.
So the Purdue has transfer requests, but she also has a
Well, actually, I did.
contract for the commissioners.
I'll do the transfer request first. Make a motion, we make a reduction in Purdue Extension travel and move it into the repair and maintenance in the amount of $360.28.
Second.
We have a motion and a second. Is there any further discussion? All those in favor, please say aye.
Aye.
Is there any opposed? All in favor, Rachel?
This is the same we've always had, right?
Yeah, is it the same amount of money?
Julia, are you on the line?
Yes, I'm here.
Okay, so your contract that the commissioners are looking over right now, they want to know if it's the same as last year?
Yes, it's the exact same amount as last year. We didn't change anything.
Okay.
At least we're making your meeting shorter.
I'll second that. All in favor? Aye.
All right, Julia, you're done. I'll send you the contract in the morning.
Thank you, Rachel. Thank you, everybody.
We're ready for Rick. You're welcome. Thank you.
That's approving that. The auditor or the recorder's request done.
As you know, a lot of our expenditures are dependent upon weather and circumstances and other things that happen during the year. Our health insurance, we knew that might be a little high because the health insurance and liability insurance and some other things are set after we do the budget. So we readjusted some things. We were able to save a lot with the health insurance. Our employees were pretty healthy this year. They did not use much of their HSA. We originally planned to chip seal 30 miles. We were able to do 47 miles because of that. That's the stone and gravel aggregates, 30,000. The service contract was a little over because we are now paying for our waste republic, which the environmental management used to pay before they moved. We are now paying that, and a lot of that's going to be reduced next year because our GPS bill is now cut in half, so we probably will not have that problem next year. Liability insurance is the adjustment with health insurance that's done. It's hard for us to adjust to sometimes budget for that, but we make sure that one's a little higher than the other, and that's what we did this year. Office supplies, that was some COVID-related supplies that we got reimbursed, but instead of doing an extra appropriation to put those in, we're just gonna zero that out from here. The good news is that our LRS is cash reserve is gonna be up by about $100,000 this year, and our MVH is about $200,000. That's despite the 5% reduction in the gas tax revenue, and we are also next year reducing our budget by 5%, just in case that happens again. If that doesn't happen again, the revenues are back up, we may be asking you for some money to pay some extra miles.
Real quick side note, in a meeting I heard the other day, we're supposed to hear about community crossings like this week. Have you heard anything yet?
Yeah, we had hit the maximum earlier this year. The maximum's $1 million. Those contracts were under by about 40,000. We had 960,000 we spent. We applied for 2 more very small projects to do that. Yeah, but we had hit the maximum already, but there was some little bit left over. And
Right.
we probably will get those.
Good, but we haven't heard yet.
No, I haven't.
Okay, because they said we might hear by the 16th. Is there a motion?
Make a motion, we make a reduction in health insurance for the highway department in the amount of 76,000. Separate that out into stone gravel aggregates at 30,000, service contract at 20,000, liability insurance at 23,000, and office supplies in the amount of 3,000.
Is there a second?
Go ahead, Howard.
I second that.
Second from Howard. All those in favor? Please say aye.
Aye.
Is there any opposed? All in favor, Rachel? Thank you, Rick. Yeah, I didn't think it was gonna be a big challenge. I hadn't heard that, if you had heard yet or not, and they asked me if we heard anything, so.
Oh, in the next couple days.
And then IT, IT is here now, so, okay.
No.
What am I thinking, yeah. I spoke.
He's working on the servers.
I spoke with IT, and he's got somebody here tonight that's a vendor, so I already knew what was going on, and was aware, so I told him if he wasn't gonna make it, that.
Make a motion, we make it a reduction in director assistant, and fuel, lube, and tires.
Oh, what?
And move that into telephone in the amount of $8,045.
Is there a second? Second from Fred. All those in favor, please say aye.
Aye.
Is there any opposed?
Zoning board? Is it actually for the zoning board, maybe?
Yeah, looks like it.
They're meeting now too, I think.
No? Are they? Where?
I thought they're meeting Wednesday.
Oh, okay.
Yeah, you can pass it. Or Tuesday.
Where's the auditor at?
What? I'm getting there. All I'm asking for is $400.
No.
Make a motion, we'll only give her $200.
Wait a minute.
And a bottle of pop.
We wanted to cut auditor training and we were looking at reductions.
Listen, I had to buy more of these and other stuff.
Well, can't you donate something?
So I didn't go to a lot of
Make a
training
motion,
this year.
we make a reduction in training in the amount of $400 and move it into office supplies in the amount of $400 for the auditor.
I'll second it.
Motion and a second. All those in favor, please say aye.
Aye.
Is there any opposed? All in favor, Rachel. Maintenance,
Yes. So he is not here tonight because he had surgery, head of maintenance, director of maintenance.
Mrs.
and-
James.
Yeah, and they needed extra help for while he was out recovering for 6 weeks.
Make a motion, make a reduction in elevator contract
Sucking up.
in the amount of $2,000 and move it into part-time worker in the amount of $2,000.
I have
Shoot, I could've moved
a
it
motion
into
and a
me
very
for like
bold second.
$50,000.
You guys.
Is there any further discussion? All those in favor, please say aye.
Aye.
And is there any opposed? And then the last one, we have one from Charlie.
Make a motion, we make a reduction, and I'm guessing that's health insurance in the amount of $13,235, and move it into liability insurance in the amount of $13,235.
I'll second it.
We have a motion and a second. Just for further discussion, Charlie, are you still in favor of this? Yeah. All those in favor, please say aye.
Aye.
Is there any opposed? All right, all in favor, Rachel. The EMA position discussion. And is this discussion directed towards trying to determine if it's going to remain full-time or part-time?
Well, I think we were gonna discuss that.
Yeah, so I mean, it hasn't been posted yet.
Yeah.
I need to know from both boards, I guess, how you want me to post it, full-time, part-time, what do you want me to do?
So right now, how much are we getting reimbursed for the position?
About $16,000 a year. The
16,000.
salary is 38,000.
So we're having to come up with 22,000 a year
Plus benefits.
plus benefits. Whereas if we made it part-time, how much would we have to come up with?
Even top part-time.
Well, and benefits, it just kind of depends. Like if that person would take a family plan, it could cost
Could
us
be
up to
80 grand.
$80,000.
Right,
Yeah,
so let's assume 80 grand.
with perf and, you know, everything
Right.
else.
So as opposed to, let's say, for example, I was just seeing if there was something that was similar in the salary ordinance. $23 an hour. Let's just say, if, for example.
I guess
it was
my
that,
thing is-
40 hours a week, that's $920 a week, 52 weeks.
If we do it part-time for 2021 and it doesn't work, nothing says in 2022 we can't make it full-time. But we're never gonna know if it's gonna work part-time if we don't try it.
Agreed. I agree with that.
That's a huge savings, you know, if you're cutting out 80,000 and getting it back down to 20.
Yeah, I mean, we'd have to define how many hours that would be. If it's, say, 20 hours, then you're paying almost $23,000. If you were at 20 plus dollars an hour, you're at 23,000 a year. And so that would only be 7,000 more than we're taking out of pocket now, but we'd be saving all the money from benefits from that person.
And is that all we can get reimbursed?
I don't
Or
know.
is that all we were being reimbursed?
That's all.
Is another question.
That's all I don't know the rules on that.
I don't either.
I think the problem is that to get more reimbursement, the EMS director.
Is that when we had to have the
And Director
second?
two had to do a PEM and they refused to do it. they're not, they don't have the time or whatever, but they're refusing or not wanting to do it.
You want a motion to make it part-time or how? do you
Well,
wanna do that,
I think
Charlie?
together, like that was just the same thing before. I think personnel wise, I think the commissioners, but we, you know. would
I think
want-
it needs to be part-time, really. At least we could try it next year, see.
I make a motion to make the paid position, part-time.
I'll second that. All those in favor? Aye.
And then you want
And
to
then you guys
motion
have
our
to-
board too.
Right.
We'll make a motion
Do
to
we need to make
create
a motion for that or do I need to do a
On
salary?
this, on the
the
salary.
salary. Right.
I don't know where I want to put that.
Well, why don't you do a range?
Yeah.
$15 to $20.
Well, wait a minute. Who makes the decision then?
You decide.
Right, so let's just set it now. I mean, we're gonna have to not make it, I don't think we can make it 15 because we might not get the quality.
I was gonna say 15 to 20.
And then we.
That's a pretty broad
and then
range
we'll
where we
review
can
the
decide where to
applications
put it.
together, like say,
Well,
or no, the commissioners would make the decision on what they want to pay them based on the credentials. Is that okay with you?
Yeah.
and the person gets hired by the EMA board, not by the
Oh, right,
commissioners.
that's right, yeah, that's right. But it would still get a recommendation from the commissioners then too, I guess, but I forgot the EMA board is the one that hires the position. So we need to get it advertised and then, so your motion is 15 to
15 to
20.
$20 an hour for the salary range.
And do the commissioners feel like that's a comfortable range?
I believe so.
So a motion, a second. All those in favor? Aye.
Aye.
Is there any opposed?
One other thing. I'm an aye for that, but how many hours a week are we planning on them working? That's something that we're gonna have to have in the,
Well, part-timers can't go over 30,
right?
so.
So minimum 20, and then I guess the commissioners would have the leeway
Right.
as well as the board, depending on what kind of a catastrophe there is, but the commissioners theoretically would up that from the 20 if something happens, something like that. And then the budget cuts, you'll see those on the board, what we kind of arrived at, and this is the jail seated move is intended just for 21.
And that's just the jail and sheriff's department insurance that's getting moved.
Yes.
And you still wanted me to cut the first line there under jail seated?
Yes.
Okay.
We're cutting the vehicle.
I think there's been enough rotated in,
Yes.
so.
Aren't
Hopefully
they,
this
aren't
is
they
only-
getting one from a grant?
They
And
used
trying to
go-
get that
go through
electric one from the-
QCAP,
Right,
too.
remember the
What's
grant?
They used to go through QCAP.
Yeah.
And the other thing is, another reason why I felt comfortable with that, just so you know, when we were talking about this, and Brad, is that we talked too about in the future about when we redo Cume Cap and Cume Bridge about, you know, maybe changing that balance a little bit. Rick was agreeable to that. So that's why 22, say for 22 and beyond, we have, you know, possibilities of, you know, other ways of looking at Cume Cap with a little bit more funding. So just reminded me too about that, the lit, about how I wanted to look at lit, but I haven't finished that. So,
Do we need a motion to change it or?
I need a motion to go in and cut these areas.
I'll make a motion that we do that.
we have a motion. Is there a second?
Second.
Since I sat in Rachel's office where we got yelled at.
And just for further discussion too, this also stems from the commissioners stating that you didn't want to cut any staff. Again, I don't know what's going to happen for 22, but this was the reason why we are taking this action. The thing that is concerning to us is that the original jail committee, one of the things, and I talked to Marty about this, was that we wanted to make sure that, you know, there was I know there's an overall cushion, but still as far as funded versus spending, not going below $500,000. This starts getting us really close. We're like 600,000 between what we collect and what we spend. So that was the thing. So 22 could be sharper razor.
And this is probably the first that the clerk is hearing about her election budget cut.
Yeah,
We're-
I don't,
It's not, we're not taking anything completely away. It's decreasing some of your line items overall.
But still had quite a bit there that was over prior. So, All those in favor? Aye. Is there any opposed? Okay. I spoke to Marty about this a little bit, and I'll just start out and then, defer to the rest of you, and I know the council, we've, talked about the whole Cisco thing. I mean, personally, I feel still like we were blindsided by this epiphany where I saw that it was in auction. I was like, what's going on? And then we took our action, obviously. I don't know personally if we need an executive session to ask Marty to move forward. Personally, I feel like it's three possible things they owe us. One could be cash. Number two could be cash plus land, or number three, land. As far as what a settlement would look like. And I won't go beyond that or talk any numbers or any specifics, but obviously we know that one portion of that property is more attractive to us for economic development. I think we need a little bit extra based on what we know is good ground for a rail spur. And that's going to take a few acres. But I think, we want to do what's best for the county and maximize what we can get back for the county. And I feel like Cisco sold us all a bad bill of goods. And
I sent that email out with all the other ones that they were selling.
Yes.
There were like 7 or 8 different locations they were selling on the same day, where they bought ground and did the same thing to other people.
Right. And Don actually made me aware of one where they had actually gifted the property back to the municipality. So
Well, get on it, Don.
the bottom line,
Kilgore, Texas.
but the bottom line is, for me, I don't know how you guys feel, but I think Cisco, especially during my tenure with this, but just in general, the people I knew in the public, that was one thing that everybody was talking about all the time. We really thought that was the thing that was going to bring something substantial to our county, and feel we're owed something back for that. So.
Another thing you could, I'm not saying you should do this necessarily, but you could consider is whether there's any, whether the overall joint board here wants to select kind of a point person from among yourself to, help me with, strategizing. So then that would kind of streamline the process a little. Obviously, any permanent, any final decision would come before everyone, but just to help facilitate negotiations. It's something to think about anyway.
That way we can keep moving forward. How do you guys feel about that?
Yeah, I think
How does the rest of the council feel?
I think we need to keep moving on it here.
I think what you said is really good, land and money, whatever.
Is there a person that we want to appoint just to
Do you
stay
wanna
with
do
Marty
it,
on it?
Dave?
I'd be happy to, but if somebody else, wants to step in, I'm totally okay with that too, but.
What are you looking at
Done
me
a fair
for?
amount of research so far. And
We'll be happy for you too, because.
How about you, Dave?
Are you guys okay with that?
Yeah.
Obviously, we would be communicating the information back with.
Sure, obviously, that'd be-
Within the LDL, what we
Right,
can, but.
but it helps move things a little, because sometimes you have to move a little quick on this sort of thing, and to get a proposal, it's just going to be a proposal in that case. Obviously, once again, it's going to go through everybody once we get to a real proposal. So it's not like any final decisions there.
And so before I try to move towards you guys, I don't want to make the mistake I almost made last time. Do the commissioners have anything for the council additionally? No? Does the public have anything for the council? Staff? Anybody? Is it all right then if we adjourn and we pass over to you?
Yep.
I'll look for a motion from the council. You have a motion, is there a second? All those in favor? Aye? Is there any opposed? So we're gonna have the merit board though. On that.
Yeah.
Something else too.
Right.
I'll think of it. And we even took care of one of Charlie's things too.
I'm all duck around this way, man.
Hey,
Yes, sir, you too, buddy.
Let's see how it
What do you got?
got something behind you.
I'm trying to get out.
Get out.
Get with it.
You're good.
How's Robbie doing?
I'll go stop by tomorrow. Get a copy.
Been on the stop by.
Oh, good. Yes.
Let's do that.
Sounds like you did.
Keep them busy with that.
Well, that's good. Is he healthy, okay?
Yeah, so.
Well, that's good.
Yeah.
Get him out of the house.
Oh, yeah.
Take care.
Let's see it. Yeah, we did that.
Yes.
Do you have like a, yeah, you can.
You want me to try that?
Like, well, let me see here.
I guess we'll go ahead and get started. And you must be Eric.
Yes, sir.
Is it Dreyfus? or
Dreyfus, yes.
Okay.
Let's see. How you doing, commissioners? Good evening. I will, here we go. Well, thank you for the opportunity. Good evening. Again, Eric Dreyfus, I'm with Assured Partners. Just to give you like a 1-minute background on Assured Partners, we're an employee benefits and property and casualty consulting firm down in Indy. We're a national firm. Again, our Indianapolis operation takes care of the whole state of Indiana. We're in about 42 states right now. So we're a pretty big organization that's grown over the past 9 or 10 years. I've been with the firm for almost 3 years. I've been doing this almost 25 years. I've been in Indiana for 15 years. I'm a Chicago transplant, but I'm a Hoosier, IU grad, but I've been working a lot with Indiana counties for the past 7-8 years. Where I was at before coming to Assured Partners, that organization had been endorsed by the Association of Indiana Counties. So I worked and implemented a lot of health insurance programs around this concept of reference-based pricing, reference-based reimbursement. So I wanted to get together with you this evening and kind of walk through some of the preliminary numbers we got based on the information that Rachel was able to share with us through Cigna, through your advisor today, about what could look like in this type of model. It's going from a fully insured, which is what you're doing right now with Cigna and you did before with Anthem, to a partially self-funded environment. I know that kind of scares people because they think self-funded, a lot of liability, a lot of risk, but we have a lot of protections around that, particularly because of the pricing, but also because of the stop loss. So the county will only be exposed up to a certain amount per individual, and they'll be only exposed up to a certain claim amount on the aggregate population that are on the county insurance. Okay. I don't know how much we want to jump into this. I have a lot to go over, but I want to go over, what's really driving the savings that I'm going to show you for Stark County is kind of part of this right here. And it's about what's going on in the healthcare industry today. A lot of hospitals, a lot of providers are making a lot of money on the backs of employers like Stark County. There's nothing really legislating here in Indiana and other states around the country about what a hospital and what a provider can charge. And what they do is they work with the insurance firms like Cigna, like Anthem, and they do that discount game. But at the end of the day, the cost to the employer is several hundreds of percent more than what typically it costs that hospital or that provider. And it falls on the backs of employees like Stark County and also the county taxpayers as well. So I'm going to just jump right into and get to the nitty gritty here. Let me skip over here. I don't know if you're familiar with a study that's been done recently, both in Indiana and nationally, called the RAND study. But what it does is it looks at each state, all 50 states, in this case 49. The only state they did not do was Maryland. And that's because Maryland's one of the few states that actually regulates what a hospital can charge, their charge master in relation to their cost. But you can see from this illustration, Indiana's the 6th highest in relative price compared to what Medicare reimburses for those services. Now, Medicare, I'm not going to sit here in front of you and tell you Medicare is the greatest thing for a hospital. On average, the hospital probably makes 85 cents on the dollar for Medicare and Medicaid patients. But in this environment, we're not paying them Medicare, we're paying them Medicare Plus. And in this environment, what we're going to show you in the pricing, we're actually paying the provider 150% of Medicare. So they're still making 50% above normally what it's going to cost them, or reasonably what it's going to cost them for those services they're providing the county employees and their dependents. Okay. This is just some examples of some of the stuff. These are real life findings that we found in hospital bills. A simple Tylenol is $500. A toothbrush is over $1,000. These are real hospital bills that we've uncovered and we've done a forensic audit of, and we've just basically hit the reset button and told the provider, we are not going to accept these unit prices. This is ridiculous. And you'd be surprised, and we'll go through this in a little bit, and I'm sure you'll have some questions about, on average, what the provider actually accepts and how much pushback they actually give back to the plan sponsor, which would be Stark County, or to the actual member or patient. Here's a couple other examples. I mean, I could go over to the local CVS and buy a box of gauze pads for $5, but we've seen a hospital charge as much as $77 for a box, okay? And what they do in some instances, they'll use 2 or 3 gauze pads and they'll charge that patient for the entire box, okay? This is the type of stuff we're trying to get away from and have the county pay fair and reasonable costs for the services that are being provided to the county employees and their dependents. So not to pick on these 2 hospitals, but in talking to Rachel and knowing where you guys are located, I feel that most of the major care that was being provided to county employees and their dependents are probably from the 2 Northwest Health hospitals outside of Stark, and that would be LaPorte and Porter, okay? These are published commercial cost center statistics. These aren't numbers we're making up. This is stuff that the hospitals have to provide the Center for Medicare and Medicaid Services in order to receive reimbursements for those patients that are Medicare eligible or Medicaid eligible, okay? So what they're showing here is that even though they're making only 85 cents on the dollar for their Medicare and Medicaid patients, they are charging on the commercial side. They're marking up their charge masters, their starting point for their ancillary costs, 623%, and for their overall cost to charge ratio, which is what we're doing here, over 500%. So what does that mean to Stark County? That means, let's say Cigna on average gives a 50% discount at LaPorte Hospital. That sounds like great, you're cutting our costs in half. However, if I told you your starting point was 5 times what it cost, you're still paying 200 and roughly almost 260% above Medicare. So you're paying almost 2.5 times what it's actually costing that provider. What we're saying is we're not going to work off this charge master. We're going to get out of the network environment and we're going to reimburse you based on Medicare Plus. And in this case, we're using, and the pricing we use 150%. Okay. Unfortunately, Porter is a little bit higher. Okay. Porter, before they became Northwest Health, their overall cost to charge ratio was almost 838%. So even a 50% discount is still going to be 4 times what it's going to cost that hospital to perform those services. Okay. And you can see some of the breakdowns. You can see labs, 1,300%, respiratory therapy, 1,400%, operating room, almost 1,400%, anesthesiology, 8,400%. I mean, I'm not a business owner, but I'd love to have those type of markups and get away with it. And unfortunately, there's nothing regulating hospitals from having those starting points. And that's why more employers are starting to explore this concept of reference-based reimbursement. So let's jump into the numbers, okay? On this illustration, thanks to Rachel and your current advisor would be able to show you that, currently on your fully insured Cigna contract for the entire 2020 plan year, the total county costs were about a little over $1.5 million, okay? Of which the employees are paying about 310, and the county's paying the other 1.3 million, okay? The renewal has been negotiated to a 4% increase, which is just a shade under 1.6 million, okay? So let's talk about the next three columns because there's a lot of variability here, okay? Let's start with the middle column. That's the worst case. So commissioners, that's like Armageddon. That means you could have the most disastrous year on record for Stark County and the employees, and the most you would spend next year would be $1.26 million, okay? Why that is because we have, and you can see this on the second line, or I'm sorry, on the third line. Third line up, you have stop loss in place. And what we do is we protect you for any individual that were to exceed $60,000 in medical or pharmacy claims in 1 year. And in aggregate, if the plan exceeded 25% above the expected level, that's this middle column here, that's $676,000. If this bumped up 25% is where we get this number right here, okay? So that is the max claim cost that Stark County would be responsible for in 2021, based on 112 employees, okay? What we've seen, and what I've done with other counties, is we've been kind of in between this range. I know that's kind of being blocked out here, but we've kind of been between the 1,020,000 and a shade under 1.1 million in the first year, because we can educate and talk to your employees and direct them to the right care, both from a high quality and from a low cost perspective. That's the big misnomer out there, is that I would be hard pressed to think that your employees feel they know where to go for the highest quality, low cost option out there, and have an advocate do that on behalf of them for something elective. Taking emergency out of the equation. Emergency, you go seek treatment wherever you is closest, and we ask questions later. From anything elective, we could put resources and tools in their hands for them to make the best informed decision based on their needs and what's their out-of-pocket expense, but also what is going to be the county's out-of-pocket expense as well. So what we're looking at in year one, again, is somewhere between, compared to renewal, somewhere between $340,000 and $500,000. Okay. Now, are these end-all be-all firm rates? I'll be dead honest with you, no. I mean, we've turned this around in about 10 days. There's still some additional information we're going to need to get from Cigna in order to firm these up. But I would think, based on these numbers, I think it's worth the trouble to kind of seek where we can find a landing spot in regards to firming up these numbers based on some, I'll be honest with you, there's been some high utilization in your plan this year with some members that we got to get some more information on. And that's part of the problem too, commissioners, is that to make decisions, I feel if I were in your shoes, I would feel there's not a lot of information that's been presented. And that's not a knock on your advisor at all. It's more on the Cigna side of things. They're not being fully transparent about where the costs are and what they're spending it on and how legitimate they are and how much of a markup there is and where there would be other alternatives to help reduce the spend that some of your members have sought in regards to some of the providers they've had to go to. Okay. We can manage this in a much better way. And what I would say to you is I would bet on yourself in this case. Worst case scenario, you're going to be 340,000 to the good in a worst case scenario. But you could be much better than that if given the opportunity of educating and sitting down and having some advocacy to your members that are high utilizers to be able to really make better decisions in regards to what drugs they're being prescribed. Is there better alternatives out there? Are there better alternatives that have the same efficacy, but are about a fraction of the cost. You'd be surprised how many doctors, when they're writing that prescription on that piece of paper, have no idea how much these drugs cost. They don't care. It's not their expense. They're going to give whatever drug either has been promoted in their own office or what they've seen or what they've heard. And they're agnostic to the cost because it's not their expense. But we're going to educate your employees to say and ask those questions. Hey, doctor, I know I need to take this for my high blood pressure, but there's this alternative that's a fraction of the cost that I've been told will be able to treat me the same way for my particular chronic condition. Those are the types of things that will start poking away at that $1.6 million that you guys are looking at right now from a fully insured standpoint. From a fully insured standpoint, the control is completely in Cigna's hands. I hate to say it, but an employer has no control in a fully insured environment. They are the judge, jury, and executioner to what your fate is. They have already negotiated. The second you walk into a hospital's doors, they have already negotiated your fate. And we're putting a stop to that in this type of environment. We're giving you the control and giving your employees and their dependents the control. I'll open up to questions.
I just haven't seen enough of this type of insurance offered to many folks. That's what I just.
Yeah, and I could give you a list of just other counties that are doing this or have done this in the past. Just food for thought. If you wanted to talk to other commissioners, if you wanted to talk to other auditors, whomever, just in this around this area, and some of the outlying areas, Benton, Cass, Carroll, Miami. I know down towards central Indiana, Delaware, on the east side, eastern Indiana, Fayette, Montgomery. Actually, Porter did it for a little while, but they kind of terminated it because honestly, I wasn't a part of that, but their model was very flawed. And they left their members exposed to some backlash from the hospitals and from the providers. Our model does not do that. We defend and represent and protect the employees.
The other counties that you named, are most of those still using it, or?
Yes. Cass has been doing it the longest. They've been doing it 9 years. Then Benton. I put in Delaware back in 2016. So we're going on 4 years now. Miami was 2015. Montgomery is only 2 years in. I don't know if Carroll's still doing it, but I know Benton and Cass have been doing it the longest. And there's also opening to possibly doing direct contracting as well, not just with Star Care locally, but also Porter, LaPorte, Logansport, Pulaski, wherever I would be able to identify, and I don't have that information, where your people seek care the most. We could work on doing, I've already talked to the CEO at Pulaski about, I was meeting with Pulaski County about doing the very same thing. And they were open to direct contract. We already have one with Logansport, but I know that's kind of a ways away versus going north up to LaPorte and Valparaiso.
I'm still like Charlie with, it's something new to me, and
Yep.
Also, who's gonna try to train our employees to.
That's where our team comes in to do that.
Drugs or whatever.
And that's where we have employee education meetings. We sit down with them in groups like, I don't know, we could do it as many times and as little of a group as possible to make sure that the message is delivered. And again, we've done this over and over with many counties. So I'm used to the type of county employee that this is going to look like it's speaking Portuguese, but it works. And it's not something they're going to do overnight and learn overnight, but that's where the advocacy and hand-holding comes in that first year. believe it or not, they get used to it. And again, you should ask some of these other counties that have been doing this several years.
Rachel, you have a question?
Thank you, Frank.
I didn't see you.
So like if county employees go to their attending physician or Walgreens, CVS, or the eye doctor or the dentist, for like, let's say January 4th, what insurance do they tell their provider that they have?
Well, they're gonna have an ID card. So they're gonna have an ID card that's just like theirs now. The only difference is it's not gonna have a Cigna logo on it, okay? It's gonna have the Stark County logo on it, but it's also gonna have the third-party administrator's logo on it. It's gonna have the same amount of information their ID card has now. The only difference is it will not have the Cigna logo. And I'll be honest with you, that first or second time they go into the doctor's office and that logo looks foreign, that's where we're gonna train or educate the employees to say,
Well, what's their copay? What's their copay?
it's gonna be the same thing. The plan is mirroring exactly what they have today with Cigna. Same deductibles, same out of pockets. The only difference is what's that? I'm sorry.
Same providers?
Yes, same provider. The only difference is there won't be any in or out of network differential because there will be no network. Everybody will be fair game. They will have the same access and the same benefit regardless of where they go.
And what if they are having trouble with getting a certain bed? I mean, do you guys take over that? Do you take over all the employee questions? and
Absolutely.
Concerns and?
Yep, and again, part of the process is that we're gonna give them, in addition to our team, we're gonna give them a advocate or a concierge to be able to, anything elective, we're gonna educate them on going through the advocate for them to set up the appointment, talk to the provider and make sure that when they walk in the door, there's no confusion. Like, what's this card? I don't understand it. We're gonna have to, again, it's gonna take time, but the employees are gonna have to rely on the advocate to do that grunt work for them up front. Again, from elective procedure. If it's something emergency, they just go get treated and we deal with any sort of issue on reimbursement and such on the back end. But something that they know that's coming up, we have them go through the advocate to make sure that that advocate does the legwork in reaching out to the provider, getting them to understand what this insurance is about and how they're going to be reimbursed. And that's how we prevent from any issues when they actually go into the doctor's office or into the hospital.
So say our employee claims are $1.7 million next year. Do you guys pay the extra?
Well, we don't, but the reinsurer will cover the difference. The most that, based on where we are right now,
Who's the reinsurer?
the reinsurer is a company. It's not going to sound familiar to you. Company is called One Beacon. And they also do property casualty. They do a lot. I mean, they're a multi-billion-dollar company, but what they do is they focus on the reinsurance for reference-based reimbursement plans like this. They do nothing but this. They don't do any commercial Cigna Anthem insurance. They focus primarily on reinsurance for reference-based reimbursement or reference-based pricing plans.
To me, right now, it feels like there's more to this than what I think there is. You know, it sounds like there's more work got to be put into this by the employees and stuff.
Yeah, I mean, there's going to be a lot of work.
They need to be going through to do so to get what they need.
Right. Yes, there's going to be more vigilance, I think is a good word to put out there for employees, but they're going to reap the benefits of it because I'd be surprised if the county doesn't save this type of money. I would assume, and a lot of my clients that are doing this, that save a lot of money, they give back to the employees either through premium holidays or reductions in their contributions, or they dial back the deductibles and out-of-pocket maxes and the exposure for those people that actually use the plan.
What if the local hospitals won't negotiate with your negotiators? Could our employees be potentially in danger of that?
No. And that goes back to, that's a great question. That goes back to, hold on a second. This, okay. So we have an arm that's part of this administration that actually will negotiate directly with the provider and take the member out of the equation. So the member will not be responsible for anything outside of their deductible or out of pocket, okay? If they get what's called a balance bill, which happens 1 out of every 10 times based on the groups that we worked on, okay? When somebody comes involved, a third party comes in to try to negotiate that dispute, so to speak, these acts protect the member from either having to pay that balance bill or being impaired from a credit standpoint. That's one of the biggest questions people worry about, is that members will freak out if they happen to get a balance bill or a collection notice. If that dispute has not been resolved yet, it is illegal for that collection agency to actually impair that person's credit. They could be heavily fined if they were to do that.
Employers not knowing that, and sometimes maybe take advantage and agreeing to something they should agree to, or things like that. I'm a little concerned about that.
Yeah.
I know some of our employees.
And the employees are kept in the loop on all developments that are going on the back end with that third party that's talking directly to the provider. And we do that as well. We're actually privy to the information before that employee might actually get a balance bill in the mail. We'll actually get that and be able to notify them ahead of time that, hey, we know you recently made a visit to the hospital. If you get anything from the provider that says you owe a dime, do not pay it. Send it to us. We'd rather be safe than sorry and not have you pay something that was not your responsibility. If we find out later that it was part of your out-of-pocket or your deductible, that's fine. But we don't want you paying something that was not your responsibility and then have to try to go back and collect it. Again, that's part of the education process. If the EOB doesn't match the bill, send it to us. Do not pay anything that says you owe a dime that isn't from that particular administrator that says you need to meet your deductible or out of pocket. If you get a bill from IU or St. Vincent's or LaPorte, do not pay it. Send it to this third party and us, and we will keep you in the loop, and we will take you out of it and directly negotiate with the provider.
And this is no offense to you or the company, but
Yeah.
I mean, I understand where Rick's coming from, and my office is the HR office. We work with all our employees. This is too complicated for us, for Stark County.
No,
I mean, that's how I feel.
I understand. I respect that. It's
What I
fair.
was thinking too, so.
I mean, honestly, if I had $1 for every county that told me that, I probably wouldn't have to work at Assured Partners anymore. But you'd be surprised how quickly they catch on, especially when it comes to their own expense. They don't want to have to pay that if they don't think it's justified. I wouldn't.
I just think there's too much involved with this than what we would want to be dealing with, especially, the employees, but.
Yeah, I don't think we're ready for this plan yet, especially,
It's a good way to put it. Not ready for it yet.
it's not ready.
I think we'll just take this all under advisement right now.
Okay.
So when do we have to have a decision for insurance? Today? Yeah, I think we'll,
The deadline today, pretty
Yeah,
much.
we're-
Unless you have a special meeting, I think you would be the last regular meeting that you would be able to approve a plan on, I believe.
yeah, I just don't think this is gonna fit for us, the county. Really.
But definitely, thank you for coming.
Sure.
Yeah, thanks a lot.
No problem.
Mhm.
I don't mind having these conversations. I respect your decisions. That's why you guys are in that position, but
And maybe over the next year, the board of commissioners can talk to other counties as
Yeah.
well.
Yeah.
Right.
absolutely. And I can,
Because I feel like this is just new enough. I think it's a few more years, maybe, possibly, but I'd like, next year, then we can talk to other counties, so.
Yeah, and I can give you, like I said, you got to, if you didn't jot it down, I can give you guys a list of some folks to circle back with in 2021, and maybe it's
Right.
something you guys position yourself for next year.
Right. Okay.
All right?
Thanks.
Absolutely, thank you. Yes.
Okay, yeah, that's fine. I'll just bring up the notes. Yeah.
There you go. Thank you. Thank you.
Thank you.
Hi.
Hi.
We sent over the notes today in the but unfortunately, I guess we didn't send over the PowerPoint, but I know about reference-based pricing as well. There's 92 counties in Indiana. There's only 6 counties that have reference-based pricing. We have 249 companies insured, all the way up to 1,400 lives, and no one is interested in reference. Our customers are just not interested in that because you're not protected under any network.
We do extensive education for the employees. We received 2 phone calls from employees from your location today asking for assistance. They're very comfortable reaching out, and we always do guide them in the right direction.
So we have great news. We were in an award to get you the best rates that we could possibly get. So I'm just gonna kind of touch base on our notes. You saw our presentation last time. Since 2018, if you turn to this in here and you go to your back, the last page in the second to the last of this presentation, you can see we just did a very easy summary for you to follow. You can see what our rates were in 2018, 2019, and 2020, and 2021. It's pretty unheard of in our market today that anyone is seeing, rate decrease since 2018, and this is substantial. So the employees' contributions as well, we have a spreadsheet in there showing you as well what the employees' contributions are on here. You can see in 2018, they were $53.08 an employee. And today in 2020, they were $45.07. We did the rate increase, splitting it between the two, and it would be a 90 cents increase for the employee per pay. The premium, Stark County's original renewal came in at a 19% increase. Holly and I fought like crazy. We were able to negotiate that down today, and it came back today like around 2 o'clock with a 0.68% increase without any benefit changes. Cigna has included a $10,000 health engagement fund, which they also gave us last year, which went to good use. Anthem's quote, matching current benefits, is a 0.45% increase. We just moved to Cigna last year. We were with Anthem prior to that for a few years. Anthem, of course, is offering as well the $10,000 premium credit. United Healthcare was a 31.4% higher out of the ballpark. Currently today, we have 112 employees insured, 52 employee only, 17 employee spouse, 18 employee children, and 25 families. Stark County does have a spousal carve out. In other words, if an employee's spouse can't get insurance at her place and she's required to do so, or him. January 2020 through September, that's the last date we have for our claims. Cigna paid $1,749,000 in claims versus what we've paid in premiums so far. So you can see that the 19% increase was probably there, yes, but they did come down. Recommendations, renew as is and increase employees' contributions by 0.668%. Our renew as is, Stark absorbed the increase. That would be a estimate annual increase, depending on how the enrollments are, of about $10,472. Cigna, we do have an alternative plan available with a $3,000 deductible. And that would be a savings of $88,529 for the year. If we were to do something like that, I would recommend that Stark County increase the contributions to the HRA. So currently an individual pays the first $1,000. Stark would increase the contributions from $1,000 to $2,000. A family currently pays first $2,000 in deductible. Stark could increase from $2,000 to $4,000. Employees would pay the next $3,000 because the out-of-pocket, the deductible is higher. As of 11/3, the HRA has paid $14,780 in claims. And that is about our average for the last 3 years. Every year is about around $14,000 to $16,000 that we've paid out in the HRA, the health reimbursement account that we have attached to our medical. We have 14 members that have been reimbursed at $1,000 or below, and 2 families over $1,000. So you can see that, you have a lot. We've had some really big claims. We really have. We've been working with Rachel to set up electronic enrollment system this year for the open enrollment period, which will come in and educate the employees. It's really nice. They can select their benefits and see the cost right there online. And that enrollment has been set up with no charge. We will be moving all the benefits if we can to MetLife. That's what's going to be able to get us that enrollment system at no charge. Inside the packet, if you want to look at the packet, and turn to the second page, we have included a spreadsheet for you to look at with the rates. You can see the rate relief of, it's down to a 0.68. And then the Cigna with the $3,000 deductible is a 5.76 savings. If you look at those 2 plans and you compare it to what we have today, you can see that the difference would be the primary care physician copay would go up $5 and the specialist would go up $10. Your ER would remain the same and your urgent care would remain the same. The individual deductible would go to $3,000 versus $2,000 today. And our family would go to $9,000 versus the $6,000. Underneath the coinsurance, currently today, if they would have a $100,000 claim, they pay the first deductible and then they pay the 20% after that. And the most they pay out of pocket is $5,000. On the Cigna plan, for the $3,000, they would pay 30% after they met their $3,000. But we, of course, would have the HRA attached to that. And the most they would pay out of pocket would be $6,500 or $13,000 for a family. Out of network is basically what he was just speaking about. And if you got a network, they don't let you off the hook. They're after us. I mean, we have claims, it's the ambulance services or the hospitals that they don't accept when somebody does not in their network. But here's the premiums down below. It makes it really easy to look at. Today, for an employee, you're paying $650.96. With the rate relief, it's $655.39. It's almost at a rate hold. The employee spouse is $1,367. It would go to $1,376, and if you went to the $3,000, that would drop to $1,288. And you can see the figures down below. The employee child is $1,236. It would go to $1,245, and a family is $1,953. It would go to $1,966.18. No one wants to pay any more out of, their paycheck any more than you want to pay. Anthem is the second page in. So matching the same plans to Anthem. The only difference with the Anthem's plan is that specialist copay, instead of being $40, it is $50. And you can see the difference is $1 something for an employee. Any questions on those plans or how they work?
No, I really don't have anything. I think we should probably stick with Cigna, but how we set it up, I guess.
Yeah, well, maybe pretty much same with the final rate really. Just depends, you have to.
Because now on that 0.68,
0.68.
Yeah.
oh,
Only like 10,000 more.
It's approximately 10,000, it was 10,600 and some dollars more a year. And you could split that with the employees if you wanted to.
well, that's what I was wondering if it'd be ideal to split it, possibly.
That would be, roughly around $5,000 more for Stark. And then the employees would share in the other difference. We're not looking at hardly any change out of the employees' pocket. They don't want any additional dollars taken out of theirs either.
It's like if you go all the way over to that. Okay, final one.
Mhm.
5.76%. The only thing is, you're changing a lot of cost factors.
Yeah, there's a lot.
Well, your family really jumps
Mhm.
that out of pocket from 13, from 10 to 13.
Yeah, I don't think that's something we're gonna do that one.
I mean, we're fortunate this year that we're in a position that we're in, that, we're getting less than 1% increase. Next year, we might need to look at different strategies of changing the HRA and the contributions.
Yeah.
So the council budgeted for $110,000 increase in health insurance, and we're actually only going up $11,000. So we're good.
Yeah. Even if we did sit at us,
Stay where you're at.
yeah, if we just stay exactly where we're at, I think we'd be okay.
Yeah, even if you stayed exactly where we're at least for 2021, we would be
Yeah.
okay.
I think that's,
They're agreeing too. What do you think?
I think we better just stick with the final rate. Yeah.
Okay, and then we're moving the dental and everything to MetLife and
Yeah,
Cigna,
I
and they
think
matched all the rates,
Yeah,
so,
I think that was fine.
okay. All right, thank you, and we'll work with Rachel then on getting set up for the meeting. I need a motion to go.
Motion on it.
Yeah, the motion we go with the final rate release.
I'll second that. All those in favor, aye.
Thank you very much.
Thank you.
Thank you.
Thanks for all the work you guys did on this.
Sorry, it was just like going back and forth, and
Well,
we were fighting for you the whole time.
thank you.
Thank you. Thank you. Thank you.
Yeah, wait till we get.
Probably.
Oh,
Probably going like.
is there a motion to approve the vendor claims in the amount of $268,072.63? I'll second that. All those in favor? Aye. Is there a motion to approve the payroll claims in the amount of $262,555.02? I'll second. All those in favor? Aye. Then we have the driveway permit. I think we're just gonna table this one.
Right, that's exactly what I just wanted to say is, it wasn't on the agenda for the
Right,
day anyway, so you can't take action on it, but really what it's for is for everybody to see it.
Yeah.
There's a couple of things I wanted to bring out, we need to talk about, and hopefully next time, I wasn't even sure if I'd get you a draft today,
Right.
but, but one of the things that I think we really need to talk about is the extent of it. I used Boone County as a model, and it was a good model, but it was, pretty fancy for us here in Starr County. And maybe I cut some things out, and there's two areas in particular that I want to highlight that I cut out of it. Not meaning that you shouldn't put them back in, but one of them is I limited it only to driveways. The Boone County ordinance actually dealt with a lot of things like installing pipelines or your road cuts, and I just limited ours to that. That maybe is an easier one. The harder one is Boone County uses this procedure where when a person has a driveway under a permit, the permit only lasts a year, and then they have a dedication of what they have into the county. Now, I didn't know whether I felt that was really necessary or if that was excessively bureaucratic. I kind of felt the latter, obviously, so I cut it out. But I do want to give serious consideration as to whether, obviously somebody could abuse the fact that we wouldn't incorporate that in. I would say that I'm not sure that a judge wouldn't feel that people still had a vested interest in their infrastructure if it got changed anyway. So I just wanted people, it isn't really for a first reading today because it wasn't on the agenda, but I just wanted everybody to be aware and to look at it and to really be, foster a dialogue on whether that's the direction we want to go.
Right.
And we'll work with the other two departments involved in this to put up a permit form. We already have one pretty much ready to go.
Right.
I just want to wait to see Marty's draft, and
Right.
we'll take a model form to that draft.
Okay.
Yeah, and that's a great one, because I think, I know, Brian, you mentioned you didn't want to have a fee for most of them. And I guess what I would suggest on that is that we would have a fee schedule, but the fees for many of them would be zero at this time. So that there would be a fee. It just wouldn't be a fee for that. It would be set at zero, and you could always decide that it was going to need a fee attached to it.
Big industry was coming in and getting an engineer to say where the driveway should be.
Right. So I think it's important to have a fee schedule that does include that when there's could be engineering expenses associated with it, that the county would be able to recoup those on a big driveway for maybe an industrial facility that was in that unincorporated area.
Right.
So it gets a little complicated, unfortunately, but I did try to simplify it. So I hope read it and see what you think.
Okay. All right. Thank you. I guess we got to talk a little bit about being open to the public. I think with this surge we've had,
I know Marshall County, LaPorte County, the town of Culver. I don't know of any other ones have close to the.
No, they just had an emergency,
Oh.
public health emergency.
They are close to the public for now,
right.
but they can still make appointments. can't
Yeah,
they?
I think we should probably.
Frank, what's your opinion?
Surrounding towns are doing it. Our positivity rate's higher than Marshall, than St. Joe, than LaPorte. We're at 11.68 currently. LaPorte's at 11.1. St. Joe County, they're at 8.48. And then Marshall County's at 5.48. We're twice that of Marshall County right now.
Yeah, I think it'd be a good idea. We could still take, appointments, for people to come in and do their stuff, and just a precaution for the employees and stuff. I think we should close the buildings to the public.
When do you want that to start?
I suppose right away, huh?
Okay. Expanding on that, do you security isn't over here, right, anymore? You guys aren't here anymore? during the day?
Not right
Okay.
now, but we can. There's still two of us working, so we could.
You
send
could
one
be.
o- If we lock the buildings down, we'll send one over here.
Yeah, that's what I mean, like who, you
Yeah.
know, are the departments responsible for getting their appointments in? Would security be over here to be responsible for getting the appointments in?
I believe that'd probably be best for security. I mean, they're gonna be at the door, so
In public that comes in,
I guess you'd have,
are they required to wear a mask?
oh, yeah, yeah.
But I would suggest that they agree, you know, prior to, you know, the appointment, as part of the process of,
Okay.
you know.
Yeah.
Have the
And if
department
somebody
heads-
doesn't want to, I did some reading about this, so if somebody doesn't want to, then, you know, you could meet outside. I mean, I know it's getting a little dicey for that weather-wise, but that's what, you know, that they've suggested. I did some reading, how to handle people that don't want to. And, you know, that's fine, just have to meet outside.
Right.
Rather than to say that they have to, if you see what I'm saying.
I mean, when we were closed in April or Mayish, when we conducted business pretty well online through email,
Right.
by the phone, appointments. I mean, it was.
I didn't do any ozations. But that's what we're looking at doing. I mean, that's it. Our rate's up high enough right
Yeah.
now where, yeah, I just.
Yeah, we better do
I
what we
have people
can.
coming in for organizations that aren't wearing a mask.
Right, right.
And, well, you can go then. Or here, you can put on a mask.
Yeah.
So.
Yeah, there should be a motion on that.
Make a motion.
Any motion on the mask saying,
It'd be like,
The,
you know, period of time.
make a motion that,
I would
starting
suggest
tomorrow.
2 weeks, maybe,
We-
until the next meeting.
When you both at the same time.
That would be my advice.
Revisit it at the next meeting.
Revisit it at the next meeting, so make your order to the next, if you don't mind, make it to be effective until your next meeting.
Okay. Well, make a motion that until our next meeting, that we will take by appointment only in the government offices and that masks could be mandatory inside the building.
I'll second that. All those in favor? Aye. Then we got the COVID testing employees.
So I've had several department heads ask me if they can require an employee to be COVID tested before they come back to work. So like this employee would have been positive off work, and the department head wants to know if they can require that employee to take a COVID test, it be negative before they come back to work. And I don't have a policy either way. I don't.
I think we should do that.
If I can say something.
Yeah, go ahead, Frank.
CDC state, they do not recommend having negative testing for return to work because some individuals will continue to show as positive after completing their isolation period.
Okay.
So that's just the state and the
Yeah.
CDC guidance on
Okay.
it. I've gone through that with a lot of employers as far as them wanting a negative test result
Okay.
and people that are continuing to test positive on week 3, week 4, week 8. So just something to consider.
Just as long, I guess, just as long as they got this right amount of days.
They have to have at least a 10-day minimum as far as from their symptom onset date. They have to complete that with 24 hours of symptoms getting better and no fever. Now, whether that happens on day 8, they still got to do the full 10 days. If it doesn't happen until day 14, day 20, whatever it is, as far as the symptoms getting better and no fever.
We had an employee, when the one came back, other employees were concerned that that person had not tested negative, and they were concerned about being safe working with them.
And that's it. Like I said, that's the state and CDC guidance, as far as if they've completed that isolation period and ended it with 24 hours symptoms getting better. If you wanted to have that, and I've talked to a number of employers, if you want a release from their physician stating that they are no longer symptomatic or showing symptoms, that would be a different thing altogether. Whereas you may end up running into to where I continue to test positive for 2 months. Are you going to pay me the whole 2 months while I'm waiting to get a negative result, or?
Physicians, I mean,
Because now I'm
that's.
going to go into short-term disability if I
good
gotta be
too.
off that long. I don't know. I don't know what all the logistics are of it, but like I
I
said.
think that'd be good, Rick.
I think so, because that would make the other employees feel
At least there's some type of documentation that you're not having an employee come back to work who may possibly be symptomatic. And then what you're doing is then that employee's incurring the cost of their copay to- if they're able to get into the doctor in a timely manner.
So Rich, do you think it would be helpful to post that recommendation, or would people not really care?
It could be helpful. We
I
have
mean-
meetings about it.
I would feel better if I saw the CDC recommended that. I don't know if any other people
We
would feel.
can post that.
Yeah, maybe Frank, you could like send me that link to that, and I'll like,
I'll try and remember.
yeah.
I'm good.
Oh, no, okay, well, maybe I can figure it out.
CDC, ending isolation.
Yeah, I'll figure it out.
Something like that.
I'll send something
I'll
out
try and
tomorrow.
look in the morning, send it to you. But
So-
state and CDC, that's what they're going by. Just my 2 cents.
Better do a motion on that.
Motion that, after you must quarantine, but, after your quarantine time's up, you do not have to
Have a physician statement to come back to work.
you can come back to work without having a negative test.
I'll second that. All those in favor? Aye. We did the mask enforcement already. That Bass Lake subdivision.
Did that.
Already
we
did that.
You got anything else?
I don't.
Rachel, you got anything?
As much as I don't want to cancel it, because I heard maybe possibly you two are going to be dancing. I think we need to cancel the Christmas party.
Me too.
So I'll make that official and send that out.
Okay.
And I do need to answer on the deed sale. Have you guys got a chance to go over those properties that I emailed you?
I have.
It's,
You got to?
I looked down.
it's
You know
mainly,
which.
They're pretty much just properties that she's got on that list.
Okay.
so I do need just an answer as to if you want to be selling all of them, just the some of them, if you don't want to sell any of them.
From what I've seen, well, we get rid of.
Yeah.
Commissioners deal sale.
Yeah, deed sale.
So we want to make a motion on that to
Yeah,
list all those properties.
you got price.
I make a motion.
No,
that-
that'll come later. They just, that's our
Right,
needs.
I'll make a motion that we list all the properties for sale so that are on that list.
I'll second that. All those in favor? Aye. Anything else, Rachel?
I don't think so.
Marty, you got anything for us? Anita, did you have something for us?
Concerning the closure of the county buildings and things, I know not to pick on Bernadette, she's not here. But the Stark County Election Board meeting is Wednesday morning. Do you prefer that to be on Zoom, or can I attend that meeting in person, or how should I handle?
Well, that'd probably have to be Zoom, I would say.
Unless you contact Bernadette before the.
Okay, I just want to be sure.
Yeah, Zoom preferably, but we are doing appointments,
Right.
so
Yeah, you could,
if it's a,
right.
Okay, thank you. That's all.
Does anyone else have anything for us?
Kathy had wanted me to address as far as nurse help. She had said something about as far as getting a computer and getting a phone. I've already talked to Richard as far as how long it's gonna take to get a phone.
Right.
Basically, I just got a table set up in my shop room because I don't have anywhere else to put anybody. And as far as a computer, I really don't want a full desktop or anything like that set up, so we can utilize the laptop that we purchased as far as when I've got somebody in there or anything like that.
Okay.
Maybe it's just gonna be a matter of I just need somebody that's able to go through the contact list and give
Right.
people the information. So it's just a matter of what I need to do in regards to getting them hired, started, what have you. So I
Right.
mean, the pay end of it, I said in the council meeting, I requested information from the state as far as how I gotta use grant money that's rolled over the previous years, but I haven't got a response from them. And the IT money that the health department got from state, $84,000 for IT upgrades. They took that away, so I've already got to figure out where I'm paying $7,700 out of, whether that's gonna be able to come out of COVID money
I have
or
money left in COVID, we'll pay it.
so, or rollover money from my grant.
Right.
But either way, it just, my concern is I don't want to have volunteers coming in because I don't want any liability for the county in regards
Right.
to
Yep.
some type of HIPAA issue or anything like that.
I think you're doing a great job too.
Trying to.
Anyone else have anything for us? If not, we'll, motion to adjourn.
Make that motion.
I'll second.
Yeah.